Hi, 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 hi. Oh, I'm starting with 10 already. Hi. Salut, salut, salut. Comment ça va? J'espère que ça va bien. I hope you all are doing well. Happy Wednesday. I love being here on Wednesdays. I love being here on Wednesdays. Hello, guys. Okay, so let's go ahead and keep tapping. Okay, let's keep tapping. That's the only way TikTok will bring our friends in here. Happy Wednesday. Are we tapping? Am I able to invite guests now? It looks like I can invite guests now. Yay. Hello, Nesty, hi. Where are my girls? Oh my god, so I can invite guests now. Perfect. I love knowing that. Salut tout le monde. Hi everybody. Welcome to Everything Nursing. So I got a lot of questions about my last video that I was talking about how to become a nurse in 1 year. Donc j'étais en train de parler de ABSN, Accelerated Bachelor Degree in Science and Nursing. And so it is a 1 year program. It's most of the time 12 months to 18 months. So very fast. It's for everybody, anyone that already had a bachelor degree in any type. It does not have to be in science. So your bachelor degree can be in anything. It can be in fashion, bachelor degree in English or anything like that, and then you can get to do nursing for 1 year. So it's accelerated. Donc c'est ça, c'est un an de formation si tu as déjà la licence, le bachelor degree, so bac plus 4. Donc si tu as la licence, en une année, tu peux aller et faire le nursing rapidement. It's really amazing. Love it. I don't know if you guys are writing anything, mais je vois rien comme message déjà. Je sais pas pourquoi. But thank you for being here. Keep tapping. Hello everybody. Est-ce que quelqu'un peut m'écrire hello? Comme ça, je me rassure que we are writing and I can read the questions. I see the likes. I see the gift. Hello. Okay, Annie. Perfect. Thank you. Thank you for being here. So yeah, like I was saying, ABSN program is for anybody that already has a bachelor degree. So it does not have to be any bachelor degree in science. Et si tu n'as pas de diplôme, si tu n'as pas de diplôme, tu passes tu commences à zéro. Tu fais le GED. Après le GED, maintenant, tu peux partir à l'école de LPN. Mais je conseille toujours de faire le CNA d'abord et après, tu pourras faire le nursing ou bien le LPN. Good evening, AD. Hi, guys. Thank you so much for being here. Welcome. We talk everything nursing here. I love the community. Oh my God, we're starting with 100 people. That's amazing. Love it. We talk everything nursing. So what I have pinned are the pharmacology flashcards. These are my favorite. Okay, they help a lot with studying. I also got the EKG flashcards. Those are the bomb, guys. I never knew they had them. I'm just happy. C'est possible de faire dans le community college. Oui, community college c'est bac plus, c'est plus 2. So it's going to be an associate degree in nursing. But if you have to go for your accelerated degree, ça sera un grand collège. Ça sera les collèges nationaux. Community college c'est accelerated degree. You're looking for LPN school without prerequisites. Guys, when you guys so I have a friend actually that I'm working with. She has this school, but she's you have to send me your city and state so I can look for that. Hi Eddie. I can look for that. So some classes do require her school requires at least anatomy and physiology plus lab, and then the TEAS exam. So when you guys have so many, someone was like, oh, I don't want any exam entry, I don't want any prerequisites. Those are gonna be private schools, and they're expensive. They're about like 60,000, 65,000. So I don't know, it depends on, on what you got, yeah, guys, thank you so much for being here. So we talk nursing, everything nursing. I have amazing stuff, guys. Check it out. Depending on where you are, if you're starting from scratch, that you need your GED, I have the GED book right here. If you're already in nursing school and you're studying for your fundamentals, or you studying for med surg, we have the books. It's amazing, guys. You need those extra stuff because nursing school books are not enough. They are long, but you need something that helps you understand quickly what's happening. Okay. Your college just accept to start next month to nursing. Yay, yay! El Baba, congratulations. We love hearing that. I love all my future nurses. Guys, it's been 3 months that we're doing this. So I know that in 2 years, I will have a lot of nurses here. You all will be invited to come and, be live with me and share your experience with other future nurses and what worked for you and what did not work for you. I love that. Thank you so much for being here. Uh, I'm in Washington D.C. I live in D.C. Been here. I when I first moved in America, I was in West Virginia, and then moved to Washington D.C. So yes, thank you, thank you, thank you. So I can see. Okay, guys, we are live on both YouTube and TikTok. Thank you for my YouTube people, guys. Check out my YouTube. I really need 1,000 people. That's all I need. It's the same name as my TikTok name, Scrub Life with Nurse Nancy. Hey, thanks for the tapping. Uh, Ati, you just finished your CNA class tomorrow, but you take your state exam in 2 weeks and still need some help. Hey, Ati, I think you and I communicated, but I don't know what you decided. You have oh, that's so nice, Eddie. Which state? Which state are you in? Tu veux faire le nurse practitioner? What's your level? What's your level, Pineapple? Shelly, hi, friend. Thank you for being here. Really appreciate you. Thank you, love. Thank you. Hi, Maria. Sin, cry. Hi. Thank you so much, my friends, for being here. Really appreciate. We talk everything nursing. Send me the questions. Yes, I'm an RN. So I did my associate degree in nursing. So I did my 2 years first, and I was a CNA at the same time. And then after graduation, with my 2 years, I was able to take the NCLEX exam. It's the same. Everybody passes the NCLEX, and then I became an RN. So it took me 1 year to do my bachelor degree in nursing, and that was online while I was going to work. I work night shift, so on my downtime, I was able to do my homework and stuff like that. So I graduated from George Washington University with my BSN. You will need flashcards for AP and one next semester. Perfect. They are good. I love those flashcards, guys. They're just amazing. I used to write down everything, but now I'm just like, I wish I had this. It takes forever to write these things down, guys. By the time you're done writing them down, you are tired. Maria, thank you so much. You want to be a nurse because your mom and sister both are RN. So what do I think you be a good unit to go to? It depends on you. What is your passion? So what I tell people, you can't tell right now what you want to be before starting nursing school, even at the beginning of nursing school, just because there's a lot. So if you want to work with babies, with mommies, with pregnant women, let's say you want to be a dialysis nurse, an ICU nurse, a labor and delivery nurse, or just a mother and baby nurse. So the good thing, when you start nursing school, they're going to take you to your clinical rotations, so you will go different places and different units, so you will have the opportunity to work with different patient population, which is amazing. So I used to want to be an ER nurse, like ED nurse. That was my passion. Why? Because of the TV, right? Because of all the shows on TV and stuff like that. Until I started nursing school, I was like, no, I don't want to be an ED nurse. Too much adrenaline, too much stress and everything. So as you go, you will figure it out, Sin. I promise you will figure it out. Hey, Carol. Thank you so much for being here. Tu as le high school diploma. So, si tu as le high school diploma, you have to be a registered nurse first. You have to have your bachelor degree in nursing first if you want to become a nurse practitioner. Okay? Si tu as le high school diploma, you can either commencer par LPN, c'est comme le nurse, mais c'est en 18 mois. Et après ça, maintenant, tu fais le bridge from nursing, from LPN to RN. Maintenant, quand tu obtiens ton RN degree, then you can go for your nurse practitioner degree, which is 2 years after your bachelor degree in nursing. How can you contact me? Just inbox me. I will let you know how you can contact me. Thank you so much. Sexy nurse. Hi. I like that name. That's pretty. See, by the way, one more question. Go ahead, my love. I'm here. Thank you so much. You know, my accent. People used to tell, my patients would be like, oh, you sound like her. I'm like, who? And they're like, her. They're like, you sound like Rihanna. I'm like, okay, I love her. She's me. I'm her. They think I'm Islander or I'm from the Barbados. No, I'm from Congo. I speak French. So yes. Is it LPN to RN correct? Yes. So you can do LPN to RN. So you can start as a CNA and then do your LPN to do your LPN degree. It's like 10 months to 18 months max. You become a nurse because you get to take the NCLEX exam, but it's the NCLEX for the LPNs. You start working as a nurse, you start making money as a nurse. Usually they start LPNs at $30 depending on your state, okay? And with your overtime, you're gonna go up to $45. And I usually recommend people to do travel nursing. Travel nursing, CNAs can do travel, LPNs can do travel, nurses can do travel. When you do travel, you're making double the money that every regular person is making. Oh, thank you so much. Thank you, thank you, thank you. C'est quoi le meilleur choice pour un nurse par rapport à quoi? Pour quelqu'un qui est CNA, il doit avoir le prerequisite or le TEAS pour le LPN. Ça dépend des écoles. Donc, pour le LPN, tout ce dont tu as besoin, tu dois avoir le baccalauréat ou bien le GED, right? Si tu as déjà le baccalauréat au pays, c'est parfait. Si tu as le GED ici, c'est bon. Si tu as le high school diploma, c'est bon. Maintenant, dépendant des écoles, il y a des écoles qui demandent des exam entry, either the TEAS exam or the HESI exam. So speaking of that, so I have this book, amazing book. Let me unpin this one and then show you guys the TEAS exam. So this book right here is for the TEAS exam for the exam entry in nursing school. Amazing. So it has everything inside. They have the new one in color. So you have math. So you'll be tested in math, in English, in reading, and science. So this is the science part. It comes with chemistry. It's easy to read, easy to understand, and most of the time you will pass it because it was made by the people that made this exam. So amazing. So yes, love it that you're doing. I will definitely get back to you next week. Perfectly. Just get back to me. I have a question, a lot of questions that I used to study with my students, get them ready for the CNA. So yes. Est-ce que CNA peut travailler à l'hôpital? Yes, CNAs are in the hospital. My hospital is full of CNAs. C'est CNAs or techs. Ça dépend de l'hôpital. Most of the time you start as a CNA. Okay? Oh, I don't have a goal. So okay guys, keep tapping. Okay, I did not even choose my goal for this, guys. I'm learning all of this. Seriously. I'm learning. Okay. Ok, so we have a goal now. So yes, tu peux travailler à l'hôpital et je conseille à tous les CNA de chercher du travail à l'hôpital. Ne reste pas dans les nursing homes. Nursing homes are tiring. It's okay to start over there, but you have to move to the hospital. Come to the hospital. Your ratio will be 1 to 8, 1 to 10. I know nursing homes 1 to 17 sometimes. It's not fun at all. So come to the hospital, 1 to 8, 1 to 10. And most of my CNAs, most of my techs are in nursing school. So they are nursing students. Guys, keep tapping. You can send a daily heart me. That's going to show TikTok that you're liking this live. So yes, check everything out. We are everything nursing. And then if you are thinking nursing, guys, LPN, RN, anything nursing that you're thinking of, you need your dosage and calculation math. So I'm pinning it here. I know it takes a lot to become a nurse. It's a lot of investment. I was broke as a nurse, single mother, broke, but I made sure I got all my extra stuff that I had to buy to give me all the chances to pass. So I wasn't doing my hair, I wasn't doing my nails, I wasn't buying clothes. I was living day to day, just food for my kids and paying for my rent. Sometimes we did not even have money for cable, but it is what it is. You sacrifice and then you earn after all, you know. Est-ce qu'on peut faire LVN sans faire le HESI? Ça dépendra maintenant de ton école. You have to contact your school. I don't know. Some schools will let you in without hi. Some schools will let you in without entry exams. Some schools will not require entry exams. Some will. Vous faites quelle branche de nursing? I'm a med-surg nurse. Donc, je fais la chirurgie générale. Med-surg nurse. Donc, voilà. C'est là-bas que j'ai commencé. En général, c'est là-bas que les gens commencent. Med-surg. Là-bas, tu apprends le tout. Tu apprends à prendre soin de tout genre de patients. Critical, non critical, et ceci, cela. Tu as le cancer, non-cancer. Tu as hospice, non-hospice. Tu as mental health patients. We have everything as med-surg nurses. Et puis maintenant, quand tu finis cela, après un an, you can decide. Tu peux dire, oh, je veux travailler les bébés maintenant et les enfants, puis je veux être mental health nurse et tout ça. Et ça prend combien de temps pour être nurse? En général, les prerequisites, les prérequis, ça prend un an. Et puis maintenant, le nursing même, ça prend 2 ans à 3 ans. Donc, 3 ans à 4 ans pour devenir nurse. Non, tu n'as pas besoin de t'inquiéter maintenant. Le plus important maintenant, go to nursing school. Start nursing school. Quand tu seras dedans, ils vont vous amener en stage dans tous les hôpitaux que l'école travaille avec. Et tu vas travailler avec tous les patient population. Tu vas commencer avec les vieillards, après tu vas faire med-surg, après ça tu vas faire les peds, les enfants, tu vas faire les labor and delivery, tu vas voir les césariennes, les bébés être nés, tu vas aller aux soins intensifs. Jusqu'à ce que tu finisses, tu auras une idée. Tu seras, oh, je ne veux pas travailler là-bas, ou je ne veux pas travailler ici, ou je ne veux pas faire ceci, mais j'aime ceci. Tu comprends? Ne t'inquiète pas pour what to choose, what specialty right now. Don't worry about that. Just go to nursing school. couramment l'anglais avant de se lancer, n'est-ce pas? Non, 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 non. Tu dois savoir lire, écrire et comprendre ce qu'ils te disent. Parce que la plupart des choses, c'est l'examen. Donc, quand tu commences, commence seulement avec les prérequisites. Commence avec CNA. Avec le CNA, you will come pineapple. Avec le CNA, tu sauras déjà quel genre de nurse you want, quel est ton niveau d'anglais. Parce que même avec le CNA, ils te font prendre un test de reading, right? Tu rentres. Et maintenant, tu as beaucoup, beaucoup, beaucoup. Tu vois un peu les questions que je fais dans mes vidéos. Tu vas savoir, tu vas comprendre, tu vas suivre. Tu vois? Quand tu commences CNA et tu travailles home health ou bien à l'hôpital. And after that, ton anglais va augmenter. C'est de savoir lire et écrire. C'est tout. Parler, là, ça va venir après. Jusqu'au jour d'aujourd'hui, il y a des nurses qui, quand tu entends leur accent, parce que we have a lot of international nurses. They like we hire international nurses. So just today I went for an interview, right? We had to interview a new nurse et tout ça. So she's international. Her English is not perfect. We don't want your English to be perfect. As long as you pass your NCLEX, as long as you can read and comprehend the doctor's orders and you can understand your patient, that's it. But still, the accents, we have all type of accents. When I say all type, it's all type. Like foreign, yes, yes. Filipino nurses. We have nurses coming from Nigeria, from Ghana. So you just have to pass your NCLEX from the country where you are. And if you pass your NCLEX from that country, hey, America needs nurses. We are short of nurses every single day, guys. When I say we're short, we're short. So every day, my job will send me a message. Can you pick up today? Please pick up today. Please pick up. No, I have a life. So you have to have that balance. Life, children. Tu prends les prérequisites, Bambi. Hey, you got this. Hey, you got this. Yes, guys, check this out. So I have these cards, pharmacology. Et comme ils vous disent, les Américains, ils vous montrent comment étudier. Donc, il faut suivre. Ce que je vous dis, ce que je vous présente tous les jours, c'est de ça que tu as besoin. C'est comme ça que j'ai étudié. Tu comprends? Quand ils te disent il faut flashcards, buy les flashcards. Quand ils te disent il faut faire les practice questions every day, il faut faire les practice questions. C'est comme ça. Parce qu'il y a trop de choses. This is a lot. This is the whole pharmacology thing. Donc, tu ne peux pas retenir ça comme ça. You have to quiz yourself every day. Mood stabilizer, brain inhibitors, platelets. Tu comprends? Tu dois te quiz yourself every day. You know? Quand tu te quiz and you like, oh, I know this. You put it on the side and you continue. That's how. C'est comme ça qu'ils étudient. Ils t'apprennent comment étudier. Is A&P hard? It's not hard. It's just the brain, you know. I have human and anatomy flashcards here. Let me pin those. It's just the brain. You just have to practice every day, guys. It's not magic. It's not. Nobody has, you know, the absolute knowledge in nursing. You just have to be practicing every day. You just have to be practicing every day. Practice, practice, practice. That's why I love these flashcards. Flashcards are amazing. I used to write down all my flashcards and everything, but now they made it so easy for you guys. So it's amazing. I'm just trying to pin these flashcards for someone that asked about A&P. So yes, for example, here you see the human body and everything. So body system, digestion. You see, you have to have these things. It makes it easy. And now they have those on your cell phone too, so you can actually everywhere you are, even at work, if you have time. Don't do that while you have work to do. When you have time, you can go to your flashcards at work and just, you know, rehearsal. It's very, very, very helpful. I love it. I love my flashcards. Skin. So this is something that you guys are gonna have to know, right? When you're taking A&P, the body system, the skin, and everything. So this is how you get to remember information, because there's so much to study. Let's say you have to study the muscles, you have to study the bones, you have to study the nervous system. There's a lot to remember, but you have to have the right tools in order to be able to. What do I recommend for med surge? Oh, for med surge, I have this book that you guys have been sleeping on. It's the Sounder. Oh, med surge. Okay, give me 1 second. I have the the Neymar, right? So that's an NCLEX. I have the T's, and I have the quick fact. So I have this quick fact from Neymar nursing. She is amazing, guys. It's in there. If you look at the shopping cart, Remar, you have it. Perfect, Sergio. This is like your brain. You just have to tell yourself that by the time you graduate nursing school, you have to know all of these things in here. So every day you have to quiz yourself. Like the thing with nursing school, you have no life. You study, you sleep, you repeat. And you have to work, you go to work. While you're at work, you have to study. So what worked for me, I was doing home health. So I was working nights. So most of the nights my patient was sleeping, so I could study. Thank you, Kay, for the follow. Guys, keep tapping. Don't forget to send your daily heart me, guys. That's gonna take us to the FYP, and we can have more people know about nursing. So yeah, and keep tapping. Remo, amazing. But above all of them, it's this Saunders, guys. I had this. This is the last generation because they have the new generation NCLEX in there. This book takes you for keep this book for your entire nursing school. It's kind of expensive. It's $100, but again, like I tell you, you have to invest. Nursing school is no cheap because you know what? Once you're done, your first paycheck, you're like, oh my God, are all these zeros for me? Can I show the pharmacology card? So yeah, of course. Those are my favorite. Oops. So yes, because by the time you're done, that first paycheck is amazing. So these are the pharmacology flashcards. They are divided in body systems. Okay, so you have the cardiovascular here. You have the nervous system, the musculoskeletal system, and they're all color coded. So you have the endocrine here. Let's look at the endocrine, for example. So these are the sulfonylureas. See, until today, there are some things that I can't pronounce. It's okay. It's part of life. Okay, so it gives you the indication. It gives you the mode of action. It gives you the contraindication, the side effect, and the patient teaching. So these are for your patients that are taking, your diabetic patient that are taking PO diabetes medicine. So some are on insulin, some gets the PO1. So this is indicated for type 2 diabetes, okay? And she has some mnemonic to help you remember. Mode of action, it increases insulin release from the pancreas. Contraindication, non-sulfur allergy, and side effect is hypoglycemia. Of course, anything that increases something, decreases something, the side effect is going to make it worse, right? So patient teaching, take 30 minutes before meal. Do not consume alcohol. Wear sunscreen. So this is what they look like. They're so pretty. They're cute. Love it. Love it, love it, love it. Love my flashcards. Guys, what do I think about phlebotomy? Est-ce que c'est bien payé comme CNA? Oh, phlebotomy est un peu plus mieux payé que CNA, je crois, ou bien around the same price. Okay, so this is the thing. With phlebotomy, you don't have any direct patient care. I think phlebotomists and CNAs earn around the same amount of money. Et avec le phlebotomist, right, you don't clean your patient, you don't clean the poop, you don't move them, you don't have to deal with feeding them or all of that. The phlebotomist in the hospital, they just call you, hey, we need stat labs. Hey, we need labs. And then you come and do the labs for your patients. You know what I mean? Um, you like my hair? Thank you. It's been, oh my God, I've had this for a while. I'm going to take it out next week. It was done in Senegal. These are the crochet, and they did the Senegalese twist with it. Thank you, thank you. You're currently taking your CNA. Okay. Sorry, guys. I'm trying to keep up with everybody. Taking your CNA class now. Do I have any advice on how to study for my all my CNAs? You know, my CNAs are my baby product, right? I study with CNAs. I work with CNAs. I just, this is where I want to start. So for all my CNAs, one, you have your skills and you have your written exam. So for your skills, my CNAs, you have to be practicing every day, okay? After school, stay with your friends, have a friend or two, practice your blood pressure, how to take your manual blood pressure, practice how to make the bed with occupied on an occupied patient, practice how to feed your patient, practice your hand washing, because that's the first thing that you gonna be tested on. Like for the board exam as a CNA, you have to start with hand washing. So you have to sing yourself your a happy birthday song, and it has to be 20 seconds max. So what, the technique matters. So practice all of that. Practice the catheter care, the Foley care. Practice entering the room. Hello, my name is Nancy. I'm going to be your CNA today. Depending on what you're doing that day, if you're moving the patient, taking them to the PT, the physical therapist, you have to check the armband. Can I check your armband? I'm going to clean you today. Is that okay? You know what I mean? So practice every day your skills. People tend to sleep on their skills. Very important. And number two, you have to practice your questions, right, for your written exam. For me, the written exam is harder, especially for people that have English as the second language. It's not always easy. So you have to practice every day, practice at least 50 questions a day. Find yourself a question bank. Again, you have to invest in yourself. You can't find everything for free out here. Nothing comes for free. So buy question banks or study with people like me, and you will get better every day. You have to practice. The more you practice, 50 questions a day. Same thing for nursing school. You have to practice your NCLEX questions from day one when you start nursing school. Don't wait until the day of before exam to practice. No, you want to practice every day. Okay. Je me suis depuis la Côte d'Ivoire. Hey, hey, hey. Hey, Che Esmond. Tu sais, moi, je suis ivoirienne aussi, hein. Congolaise de sang, mais j'ai grandi en Côte d'Ivoire, j'ai grandi à Abidjan, j'étais à Cocody, après j'ai grandi à la Riviera Palmeraie, à la troisième tranche. So, ça, c'est chez moi. Hello de la Côte d'Ivoire. 85 question is better when you're a foreign language speaker. Exactly. It just depends. If you're not studying for NCLEX, 85 questions per day is going to be a lot, because you have to do your reading, you have to do your foreign your care plans and everything. So 50 questions is the most, what do I think about? Oh, thank you, Maman de Garçon. You're taking your prerequisite nursing class. Them classes the classes are hard for you. What classes are you taking right now? You want to buy the question bank for MedSurge. The best, yes, buy the question bank for MedSurge, but ask your professors. There are question banks for everything throughout nursing school. If your program is 2 years, you just buy for 2 years. You know what I mean? So you don't have to buy for MedSurge and then you're going to buy for OB and then you're going to buy for, fundamentals and everything like that. Ask your professors what they recommend is number one. And if you guys are using ATI, don't sleep on ATI. Whatever question bank or whatever company you guys are using. If you're using ATI, ATI has a million of questions. Like as students, you just go and do your assigned questions from ATI, but just be curious. Go in there and do all the questions. Bonsoir, tu es étudiant en infirmière au Québec. Comment faire pour travailler aux USA? So, pour travailler aux USA, à tous mes amis québécois, français, africains, everybody, quand tu obtiens ta licence, right? Quand tu obtiens ta licence, tu dois contacter, il y a une structure ici qui s'appelle le CGFSN. C'est la structure que tu dois contacter. Tu vas créer un compte et tu vas être en contact avec eux. Tu vas leur envoyer tes diplômes. Eux, ils vont analyser tes diplômes et tes bulletins pour se rassurer que tes études ont été au standard des études américaines. Donc, quand tu finis cela, tu choisis l'État où tu veux travailler. Et maintenant, tu appliques pour passer le NCLEX. Donc, le NCLEX, c'est l'examen national qui va te permettre d'avoir ta licence. Donc, en général, je conseille, j'ai ce livre-là pour le NCLEX. J'ai ça dans plusieurs de mes vidéos. Tu peux commander ceci, le lire, ou bien tu peux aussi prendre le Saunders. Saunders, c'est plus en détail. Donc, il y a 2 livres. Tu peux m'envoyer le message. Je pourrais te conseiller les livres. Maintenant, quand tu passes l'examen, donc tu dois déjà commencer à apprendre ton anglais maintenant. Learn English for all my international nurses that want to come and work in the United States, because again, we need nurses. I promise we are short everywhere. Nobody will tell you nurses are not needed. If someone tells you that, they are lying. So we need nurses. So you have to learn your English. Apprends ton anglais et comme ça tu prends l'examen. Tu peux prendre l'examen à partir du Québec, à partir de là où tu es. Dès que tu passes ton examen, c'est tout. Il y a une agence, tu peux trouver les agences qui vont te faciliter les job interviews. Parce que dès que tu as la licence, quel que soit l'endroit où tu es, les Américains te veulent pour venir travailler ici. Et c'est comme ça, tu vas faire le job interview, tu obtiens ton travail et tu viens directement travailler ici. Pour vous, vous n'avez pas besoin de visa, mais en même temps, tu as besoin de visa de travail pour rester ici. Donc, c'est un peu ça. Hi, guys. Julius, hi. Thank you, friend. Thank you for being here. So, I'm live on YouTube as well. Guys, go, go subscribe on YouTube. We're still little, small on YouTube. But I promise I have big plans for us. I'm going to be making long videos with all the information that you guys need, because TikTok only gives me 3 minutes for videos. So yeah. Est-ce que pour quelqu'un qui est déjà ici si tu es déjà ici aux USA, c'est la même chose. Tu dois passer le NCLEX, tu dois faire évaluer tes diplômes, tu dois passer l'examen national pour avoir ta licence. Et après ça, maintenant, tu es déjà ici, tu cherches le travail dans n'importe quel état où tu es. Hi, Sisi! Sister Letitia. Hi, Mama. La. Hi. Thank you for being here. So we're talking about nursing. We're talking about everything nursing. You know, guys, I have my doctors here. I have my nurses, my international nurses here. On est trop intelligent, guys. Ce que je vous dis tous les jours, on est trop intelligent. Ne dormez pas sur l'anglais. Ne restez pas là et dites que, well, oh, you're taking chemistry. I promise, chemistry gave me headaches. 3 classes that almost killed me in nursing school. Number 1 was microbiology, because I couldn't figure out how to use everything. You know, nursing is a 2nd degree for me. So I wasn't young when I started nursing. I was almost 30, okay? I was end of my 20s. So having to figure out what are those things and read the cells and this and that was so hard. So I barely passed microbiology with C. And then anatomy and physiology wasn't bad, okay? But chemistry was hell of a hell. I did not study here in English. So I was struggling with English. And then I had to take chemistry. And then the 3rd one was pharmacology. But yes, but look at me now. I made it. So it's possible, guys. Just go to your library, guys. Go to the library every day if you can. You have tutors there. They're going to help you out. If it's chemistry, whoever is struggling with chemistry, Go to the library. Go to your study center. Those people are there. They're smart. They're doing chemistry, chemistry degrees. So they're smart. They will help you out. Go there every day. That's how you're gonna learn, because they're gonna show you tricks and tips and stuff like that. Aisha Touré, hi, hi, hi. C'est pour ça qu'on n'est pas aimé. Je te dis, on est trop intelligent. Dr. D, hi to all my doctors. You got this, guys. You got this. C'est la langue seulement. C'est la langue seulement. Sinon, on en a dans le cerveau. Je vous jure. Who's this? Dr. D, what do you mean I don't... Don't get started. Mwanamboka. Hey, look at this Mwanamboka. C'est toi qui est... Guys, I will... You know what? I need to bring you... Can I bring you up for my... for this live, please? You can give few tips. Now I can bring friends up, you know? Dr. D, if you're not ready today, that's fine. We can plan another day. Oh boy, pardon que boy était. Maman Laetitia, parle à ton frère ici now. Il est docteur ici. He started as a nurse, and then he became a nurse practitioner, and now he's a whole medical doctor. He's from Congo. LPN font des vaccins pour les patients. Yes, on fait tous les vaccins. Tu apprends à faire les vaccins. Donc, tu fais les vaccins, tu fais les shots, tu fais everything. Donc, tu dis, c'est toi qui as disparu, c'est pas moi. Nurse Hassan, hi. Nurse Hassan, let me bring some friends. Thank you, thank you, thank you. Non, c'est pas ça, c'est toi qui as disparu. Tu vis la belle vie de docteur. Hi. Yes, guys. Donc, I haven't. Thank you so much for being here. Guys, check out my YouTube. Check out the YouTube. You need to pump me up on YouTube as well, because we're doing amazing on TikTok. I love it. Keep tapping. I'm not seeing the hearts. Thank you. Okay. Okay. So yes, guys, check out all the tools that I have for you. This is how you succeed nursing school. You need those extra books. You need this book, guys. You should never sleep on Sanders. Sanders is amazing. Let me pin this book. Let me pin this book. This is my favorite book. This book helped me a lot. Sometimes you're reading those nursing school books and you're unable to understand. But then again, you need a book that's gonna help you out. You know, this one page of this book is like 20 pages of your nursing school book. So it's the most important things that they get for you. So you have all the subjects that you're gonna be learning in nursing school. So if it's $100, let's say you spending $35, $20, $30 in each book, but this one has all the subjects that you need, and it also has questions. It has questions bank. It has more than 6,000 questions. Like seriously, you have the questions online and you have the questions in the book too, and the questions come after each chapter. You have questions. I just love this book, guys. I had one of those. Okay, I had New Word. I had this. I had nurse generation something. I had a lot of stuff to help me out, because only your nursing school books and your professor's PowerPoints are not gonna help you out. And also check out the YouTube. Check out Registered Nurse RN. Check out Picmonic. If you're taking pharmacology, I need you to go check Picmonic on YouTube and check Nurse Mike. Those are the 3 people. And Level Up RN. What am I talking about? 4 people that help me out. So yeah, check those out. So these are the things that I use actually used to study when I was in nursing school. For example, now I have these. These are smaller and they are cheaper, but these are the ones that I use. These flashcards. This is for only anatomy and physiology. So I researched right on YouTube what helps you pass nursing school. So those are the things that people were talking about, like I'm telling you now. So get your flashcards, get get your question banks, check YouTube, register nurse.com, register nurse RN, um, level up nurse RN, and then nurse Mike too. Thank you, thank you, thank you, thank you guys for the follows. Are we tapping? Continue à tapoter. That's how we say it, right? Tapoter. uh-huh. So yes, guys, I know it seems a lot. You're not gonna make sense of it now. It's when you start. It's like military training. It's like when you're pregnant and you give birth to that baby. Everybody tells you everything, but you have to stay focused and know what's the goal. The goal is to pass and remember your why. You want to save people's life. You want to change your life, right? If you're first generation nurses in your family, you want to do that for you. You want to do that for your kids. For all my single mommies here, I got you all. You want to do that for your babies, because once you get that RN license, that's it, you know. You have time to spend with your babies. So yes, remember your why when it gets hard. Dr. D, any advice here on how to make it through nursing school? Bonjour, Leo Kadi. Hi. Thank you for being here, my sir. I need my charger, my computer charger. I'll be right back. Thank you so much for liking and following. I'll be right back. I'm gonna grab my charger. I forgot my stethoscope. How did I do that? Hi. Thank you for being here. Any more questions that I can answer? I'm here for that tonight. I love that we get to, yeah, I'm here until 8 p.m. Thank you so much for being here too on YouTube. Thank you guys. I need to plug this. Give me a second. Alright guys. Tu veux le tease que j'avais montré la fois passée? Le book du tease? Yes. Attendez-moi une seconde. Envoie-moi le message, mais tu peux regarder sur les vidéos là. Quand tu regardes sur les vidéos, tu peux cliquer directement où il y a le petit panier. Ou bien même ici. Même ici. Attends, je vais pin le tease maintenant, le tease book. Voilà ça. Tu dois pouvoir voir ça sur ton écran. Si tu cliques dessus, tu peux commander directement. Est-ce que tu vois ça, Léo Cardi? Est-ce que tu vois le livre du tease right now? Queen Bee, hi sister. Ok, je vois que tu vois ça. Donc c'est comme ça, tu peux rajouter ça à ta carte directement. Add it to your cart and then you can order like that. Queen Bee, hi sister. Thank you for being here. Thank you guys. So welcome to Everything Nursing, guys. I'm sharing everything that worked for me in nursing school and also telling you guys it's possible. I was able to do it with my twins. My twins were only 3 years old when I was in nursing school. They are 10 now. So we survived nursing. The babies and I actually survived nursing. Un livre pour CNA. Ok, sure. Envoie-moi un message, je pourrais t'envoyer le link parce qu'ils ne vont pas me laisser parler d'un livre qui n'est pas d'ici, quoi. Donc, envoie-moi un message, je pourrais te recommander. So yes, guys, yes, c'est possible. Nursing school is not easy, surtout pour nous qui venons d'ailleurs, mais en même temps, comme je dis, à chaque fois, c'est difficile. C'est difficile d'étudier au pays. C'est plus difficile d'étudier au pays que d'étudier ici. Parce que toutes les questions ici, c'est à choix multiple. Nursing school questions are kind of tricky. You just have to learn what's up with those. All the answers are correct, but what's the most correct answer? C'est ça la différence. Sinon, étudier ici, c'est facile, sincèrement. From us that are foreigners, où tu étudies debout, tu étudies dans l'amphithéâtre, parfois tu n'as même pas le courant. Et quand tu demandes au professeur what are the questions in the exam, de like étudier tout du début jusqu'à la fin. Ici, c'est pas comme ça. On te donne le syllabus, on te donne le study guide, on te dit exactement. J'avais des professeurs qui te disent, oh, pause guys, this PowerPoint is going to come into your exam. Ou bien, j'étudie avec certains amis ici, les professeurs leur donnent 200 questions. On leur dit d'aller étudier, d'aller faire ces questions à la maison et ils vont choisir from those 200 questions, they're going to choose what's going to come in the exam. Donc, pour vous dire que c'est pas difficile. Vraiment pas difficile, c'est juste que ça prend du temps. Parce que most classes are 50 minutes. But then again, you're going to do the most of the work at home because you might read 100 pages before going to class. You have to research, you have to work on your projects, and then you get to class and do what you gotta do. So, rien n'est difficile ici. Nursing n'est pas difficile. Thank you, Bambiana. Thank you for the follow. Love, love, love making new friends around here. Thank you. And come back for more. Guys, check out the YouTube channel. We're still babies, but it's the same name. Le YouTube, c'est le même nom que le TikTok name. Va me suivre là-bas, va me follow, va souscrire comme ça. Je pourrais créer encore plus de contenu pour vous aider throughout nursing school. Okay? I just need you guys. Oh, je t'en prie. Lux Gold. Thank you, love. Thank you so much. Thank you for your support, guys. I feel like we are connected. We are all connected now, okay? We're all connected. It's only been 3 months that we are here. But guys, I read all your messages. I take my time to read them. I might take 3 days before responding, mais je lis tous les messages. I make sure I read, I respond. Sometimes I got nursing related questions, relationship related questions that make me cry, but I get all type of questions and I respond. So I love this community. I love this sisterhood. Just think that you have a virtual sister actually. So I love it. I love it. I love it. Thank you for being here. And thank you for the love, guys. And you know I got you all. Everything that I get that's new. Oh, also guys, si vous êtes dans le nursing school, if you're in nursing school, first semester or whatever you are in, rappelez-vous, there is the nurse intern program. So, le stage des infirmiers. So, what does it's you go, you apply for that through your school, and then for that semester, they're gonna have you work with a nurse. So you follow a nurse. I'm gonna teach you everything I do, from vital signs, from giving medicine, communicating with my patients and everything. And they pay you as a CNA. So my hospital pays $22 an hour. So while you're in nursing school, you learn to become a nurse and you get paid for that. Isn't that amazing? So regardez dans le stage de nursing. And I also learned that they have that for LPNs too now. Moi, je pensais que c'était seulement les RN, mais maintenant, il y en a pour les LPN aussi. Il y en a pour les LPN. Donc, tu peux être à l'école. Pendant que tu es à l'école, ton école travaille avec des hôpitaux. You can apply pour être stagiaire avec une nurse. Et puis, on te paye pour ça. So, you're learning, guys. So once you're done, you won't be a zombie like I was, because moi j'ai graduate during COVID. So I graduated during COVID and it was hard, guys. My two last semesters were online, so I had to take classes online. I did not get to take care of patients. I never had ICU experience. I never had GYN experience or PEDS clinical. So everything was online. We were watching YouTube videos on how to take care of patients. It was hard. So you guys have chances to go actually learn from a nurse, until you graduate. You come back from to that hospital, because let's say you do your nurse internship there, externship there, they will hire you. Usually we'll ask those nurses, hey, do you want to come back work for us? If you're really good, you have to show that you're really good. Okay. Salut Sosten, comment tu vas? Thank you for being here. So you have to show that you're really good, guys. Be on time, be invested, ask questions. There are no dumb questions. That's what I tell all my orientee. When you start, first you start as a nursing student, nursing extern, nurse, new grad nurse. There are no stupid questions. Et c'est l'Amérique, guys. Ici, ils vont pas se moquer de toi, ils vont pas dire que tu es bête. Si quelqu'un dit que tu es bête, c'est que la personne même n'est pas intelligente. Parce que we all started from somewhere. How do you become an EKG technician? You go to a training. Usually it takes 6 months to a year. It just depends. Some schools are 6 months, 4 months, 6 months, 8 months. And then you go and learn about EKGs. Oh, let me show you guys my EKG cards. Those are my new favorites. Like I was telling you guys, les Américains, ils ont les flashcards for two. C'est comme ça qu'ils étudient. So you want to study like that too. It's easy. Oh my God. I'll make so many videos about these EKG cards. They are amazing. I'm gonna go ahead and pin them. Amazing, guys. Love them. So it's Level Up Aaron again. She's just the bomb. I love people that think about nursing students and make things easy for them. Do I advise? Amazing, guys. Do I advise you to book as a new learner? What do you mean, book as a new learner? I did not get that part. So, guys, these are the... So, okay, one thing you need to know about EKG, right? You're going to learn about the heart, anatomy and physiology, right? You're going to learn about how the heart function, how the oxygen is brought through the blood in the heart. You're going to learn about that. That's why you do anatomy and physiology, right? How does the heart function? So you learn that. And then once you get in nursing school, you're going to learn now how to read an EKG. So this tells you when a patient is normal sinus rhythm, that's a normal person. Like that's the normal blood, like let's say the normal blood pressure is 120/60, right? The normal sugar is 60, right? The normal potassium is 3.5 to 5, right? The normal heart rate is 60 to 100. The normal respiration is 12 to 20. So these are the normal. So your normal heart rhythm will be the sinus. Okay, so that's the normal. And then when a patient comes with AFib or a patient goes into AFib, what's happening? Okay, when a patient goes into VTAC, what's happening? So you have to know that. Once you're done, so you're gonna do that in nursing school. You're gonna be tested during the NCLEX, and once you graduate, don't think it's over. Every nursing job that you're gonna apply to, they're gonna test you on your EKG strips. It is what it is. You have to know what's happening with your patient's heart. All the hospitals want you to know that. So these are the flashcards that you're gonna buy, and they're gonna help you for the rest of your life. As a travel nurse, The time I did travel nursing, every contract, the only thing they were requiring is to go take the EKG testing. It's just that. As an ICU nurse, as a med surg nurse, as a labor and delivery, that's even worse with labor and delivery, because those women are pushing the babies out, and then the heart rate is racing. You don't know what's happening. You have to know what's happening. So these cards are going to follow you for the rest of your life. So it's a good investment. You want to invest in it. So like I was saying, asystole, this you have to know. When there's no pulse, the line is straight, it's asystole. And then she tells you what to do when the patient, it shows asystole, right? It's there. So you start CPR immediately. Okay, so there are things that you just have to know. First degree block, second degree block, you know, all the changes. And also there are medicine that work on the heart. So you have to know those things, because you're gonna have your patient on the telemetry. You have to be reading what's happening with your patient. Hi connection, thank you so much, sister. Thank you, thank you, thank you. I love when my ladies show up and show out. I really love that. Thank you. I was so involved telling you guys about telemetry that I couldn't even read. What do I think about technical college CNA? Yes, CNA is great. That's how you start. That's how we all started. CNA is the basis. That's the entry level in nursing, you know. My director, my director of nursing, our CNO, all the big names in hospitals, they will tell you they started as CNAs, and then they went to LPN, or they went to RN, and then they did the masters, and then they did the doctorate degrees in nursing, you know. So that's where you start. That's the beginning. Yes, yes, yes. Thank you for all the follows, guys. Keep tapping, guys. Last time we got to 30,000 likes. Let's get there. Hey, Madame Diallo. I'm doing fantastic, sister. How are you doing? Okay, guys, where are you connecting from and what are you working on? Je veux savoir où est-ce que tout le monde se connecte. Sosten, comment tu vas? Je sais que j'ai des amis qui sont au travail, ils ne peuvent pas taper, mais au moins, vous m'entendez. Nadej, hi, lovely love. Like I was saying, guys, I promise in 2 years I will have so many nurses, and I will be a proud mama. I will be a proud nurse. I'll be like, hey guys, come to my live and come share your tips, because you know, every year, every semester we have new nurses coming to nursing school. So I will invite all of you. Nadesh, be ready. So Stan, tout le monde, soyez ready. Miss Letitia, toi tu es la docteure, donc toi-même quand tu viens, you know, mama. Thank you for the follow. Thank you, guys. I really appreciate it. And I like that guys are here now. Je pensais que c'était seulement les femmes. Parce que ce compte-là, c'était pour les femmes. Hein? Surtout mes single mothers. OK? I got you to the bone. Et c'est amazing que je vois les hommes maintenant se connecter, qui me demandent est-ce que les hommes peuvent être infirmiers. Of course, les hommes peuvent être infirmiers. You guys are needed. On a besoin de vos muscles et tout ça. Et puis vous, les hommes, vous êtes drama free. Il n'y a pas de drama quand les hommes sont là. Donc, quand on a besoin d'aide pour changer les patients, pour tourner les patients, les hommes sont là, ils viennent, ils aident et tout ça. So, yeah, we need our guy nurses too. Tu peux me contacter, envoie-moi un message, Kazi Dior. Envoie-moi un message, comme ça tu peux booker un rendez-vous sur mon site, comme ça on pourra parler. Je fais le coaching là-bas. Thank you, Nadesh. Oh, thank you, my love. Shelly, you know what? You are the bomb. Thank you so much. I really appreciate this sisterhood, guys. I really appreciate you. Just think about it. You have a virtual sister. If you want to talk, you want to ask questions, anything, send me a message. And don't be upset if I don't answer in 2 days, 3 days. Maximum is 3 days, but I get to all my messages. If I show you my my captures, I have like $80. I wish it was $80. 80 questions a day, 80 messages per day minimum. So it's not a full-time job yet. I still have the job, I still have the kids, I still have the coaching. So I get to you in 3 days. I promise. Thank you so much for connecting on YouTube as well, guys. Donc c'est ça. Lydie, tu dis tu attends quoi au fait? Quand on veut faire les études d'infirmière lorsqu'on arrive aux USA, on s'inscrit dans quoi? So, quand tu commences aux USA, quand tu arrives aux USA pour la première fois, pour la première année, je veux que tu t'inscrives au ESL, c'est English as a Second Language Programme. C'est là-bas que tu vas apprendre l'anglais. Ok, parlons de ça. J'ai des amis qui m'ont envoyé dans un message pour dire que, well, je suis arrivée, on me dit que je peux trouver un job et apprendre l'anglais comme ça. Non, 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 ça ne marche pas comme ça. L'anglais que tu apprends dans les streets là-bas, ce n'est pas le même anglais que je vais apprendre à l'école. C'est comme le français qu'on parle. À Abidjan, on parle le nouchi dehors. À Kinshasa, on parle le lingala mélangé avec le français. Ce n'est pas le français de l'école. À Dakar, là, c'est grave. C'est Wolof Nangadev du matin au soir. Donc, ne venez pas m'attaquer les Sénégalais. Vous savez que vous êtes ma famille. Donc, juste pour vous dire que l'anglais du dehors, l'anglais du travail, de Walmart, ou bien l'anglais de, de Pizza Hut, ou bien l'anglais où tu apprends au mall, c'est pas le même anglais. Donc, je veux que tu ailles à l'école. Tu fais le ESL. ESL va te donner les basics. C'est comme le français. C'est comme ça. Tu as appris les structures de la phrase et les structures des paragraphes. Et aussi, tu as appris les structures de comment faire un essai. Right? C'est la même chose en anglais. Donc, va faire tes cours d'anglais. Et après ça, je te conseille de faire CNA ou bien faire Home Health Aid. Comme ça, tu es en contact avec les gens qui parlent seulement l'anglais. Donc, ça te donne la facilité. Tu apprends. Tu as besoin d'apprendre l'anglais médical. Parce que l'anglais simple n'est pas la même chose. Thank you so much. Yes, JD. L'anglais simple, c'est pas la même chose. Tu as besoin d'apprendre l'anglais médical. Et quand tu fais CNA, on t'apprend à faire les vital signs, on t'apprend à t'occuper du patient, à communiquer avec le patient. Tu apprends tout. Regarde mon YouTube. Je suis en train de mettre les vidéos sur comment vous apprendre les vital signs, comment vous apprendre ceci, comme CNA. Donc, va sur mon YouTube. Mon YouTube, c'est le même nom que le TikTok. Va. J'aurai plein d'informations là-bas. Do I help with NCLEX? I'm working on it. Oh my God. NCLEX is a bigger ball. I'm working on it. But I will let you know. Just message me, and I have already a few friends that really want me to help with the NCLEX. It's just like it's a lot. And I'm just, I'm trying to manage my time. It's about time management, because if I decide to study with you for the NCLEX, it has to be every day, at least from Monday to Friday, where we get to study for the NCLEX. And I don't have that time yet, but I'm working on it. I'm trying to see how I can help out, because my goal when I help you out is to succeed. I don't care about everything that comes after, but I'm happy when you succeed. So I've been doing that with my CNA people. Hey, and yeah, the NCLEX will come. Thank you so much for the follows, guys. Où est-ce qu'on peut envoyer le message? Donc, quand tu cliques sur mon nom là, si tu vois mon nom en dessous, ça dit message. Donc, tu peux m'envoyer un message. Je crois le premier message, le deuxième message, ils ne vont pas te laisser si je n'ai pas encore répondu. Mais avec le premier message, tu peux déjà être précis sur ton nom et sur la raison pour laquelle tu m'envoies le message. Comme ça, je pourrais te répondre. Yes, tu peux être CNA et travailler à l'hôpital. Ils vont t'embaucher, tu dois avoir l'expérience. Il y a certains hôpitaux qui sont très, très exigeants, ils veulent l'expérience. Il y a certains hôpitaux qui s'en foutent de l'expérience. Thank you so much, guys, for checking everything that I have. The EKG cards are the bomb. Si tu fais le EKG training, if you're in nursing school, IPN school, anything, you need these EKG cards. They help you, like very helpful flashcards. Donc, si tu fais le CNA, tu peux commencer à travailler dans les maisons de retraite, right? 3 mois. Moi, en général, je conseille 3 mois. Après 3 mois, Tu viens, je fais ton CV avec toi, ok? J'ai un service de CV. Tu viens, je fais ton CV. Tu mets ton CV sur Indeed. Et tu auras des hôpitaux qui vont t'appeler pour t'offrir du travail. We always need CNAs. Always need nurses. We're always short. Thank you for the follow. Hi, hi, hi. Hi, sister. Thank you so much for stopping by and showing love. Comment chercher les hôpitaux avec avec quoi? Avec les stages. Donc pour les hôpitaux avec les stages, if you're in nursing school, you want to do the nurse extern program, you just have to ask your school, ask your career office, ask your clinical professor. Ça doit être avec tes professeurs, avec ton école, because they work with lots of hospitals. So they will place you and then you can get started. We usually hire a lot of nursing students to be our nurse externs just because we know that if you like the floor, we offer you a job when you're done, you come and work for us. So, en général, c'est comme ça. That's the thing, the beauty with nursing. Yes, 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 guys. So, anatomy flashcards, EKG flashcards, um, pharmacology flashcards, guys. You cannot survive pharmacology without all the tips that we give you, right? You need those flashcards to remember the medicine. With the meds, you have to study them by what they do to the body. You have to associate the disease with the med, you know, the side effect, the nurse teaching, and make sure you have a study group. Have a study group, have friends that you're studying with that are smart, okay? We're all smarter than you. But you have to have a study group. You cannot survive nursing school without study group because you're gonna cry together. Like crying in nursing school is all we do. We cry when we're happy, we cry when we're sad, we cry when we don't pass the exams, we cry. Nursing school is made of crying. Nous aussi, on va faire la médecine. Yeah, yeah. On va faire la médecine, c'est ça. Only the sky is the limit. Yeah, so you need friends. You need study mates in nursing school. I promise. Est-ce qu'on peut commencer en prenant un ou deux classes? Yes. Pour les prérequis, tu peux prendre une classe, deux classes. Let's say your school, si tu veux faire nursing school, your prerequisites will be English, mathematics, science classes, anatomy, biology, chemistry. Some schools want chemistry, some schools don't. You will need I had to take nutrition, I had to take statistics. So toutes ces classes, you have to take them before taking your TEAS exam and applying for your nursing school. So you can take one class at a time or two classes at a time. It depends on how fast you want to finish your prerequisites because it takes time if you take one class at a time. But it's fine. Go with your learning level. Go with your what you can do at the time. You know, we all have life happening and stuff like that. But once you get accepted to the into the program, they are the ones that are giving you the schedule. So it's gonna be 4 classes or 3 classes or 5 classes. So prerequisites, tu peux prendre une classe, deux classes. Maintenant, quand tu rentres dans le nursing school, ça sera eux qui vont décider. J'espère que ça it makes sense. Le message ne marche pas, quasi. Ah, je sais pas pourquoi ça marche pas. Mais attends, je vais écrire ton nom quelque part et puis je vais te rechercher. Ok? Quasi Dior. Some people have time studying with other though. Ah, my sister, in nursing school you're gonna have to. You don't have to be studying for hours together. You can have a study group, and since COVID we do Zoom studies. You know what I mean? And you can just Fatima's but study groups are good because you remind yourself things. In nursing school, you can't remember anything, everything. There's so much. Clinicals itself has its assignments, its reading, and you're going to be writing your nursing care diagnosis and stuff like that. Care plans. That's the clinicals. And then if you're taking different classes, each class you have to do the reading, you have to do the quizzes, you have to do the researches. It's a lot. So um, you have to have a planner. I'm working on a nice motivational planner that's gonna come soon. You have to have a planner, right? A planner where you write everything down. You remind yourself. I used to have a planner on my refrigerator, especially if you have kids. You have to remember the sports, the school stuff, your job, and all of that is insane. But if you have study mates, and there are some quizzes we used to take turns, I did not tell you that, but you take turns. Oh, you take the quiz this week. They take it, you get the infos, you get 100%, and then next week we take turns. Because you don't have time for all of that. It's crazy. So you have to organize yourself, okay? Tu voulais t'inscrire pour EKG. Miss Umu, I love that. Tu peux faire EKG, tu peux faire PCT aussi, Patient Care Technician. On t'apprend le EKG dedans, on t'apprend le phlebotomy dedans. Donc ça fait que quand tu finis, tu as une connaissance générale et on peut te hire facilement. Mais EKG aussi est bon. Tu as fini avec phlebotomy, mais tu ne trouves pas un boulot ni stage. Comment faire? Princesse, va à la Croix-Rouge de ton quartier, de ta ville. Va à la Croix-Rouge. Il faut leur dire que tu veux être volontaire. Tu peux faire du bénévolat avec eux pendant que tu les assistes. Comme ça, tu apprends les techniques. Pendant que tu es là-bas, s'ils voient que tu es vraiment investi à 100%, ils peuvent te donner du boulot là-bas. Parce que moi, j'ai fait la Croix-Rouge quand j'étais en nursing school. I did volunteering with the Red Cross. Very important because your last classes, your last semester of nursing school, they're gonna ask you to do some volunteering job. You have to write a whole essay document about how you can help, that patient population of that university too. So you have to do volunteering somehow, somewhere, and hospitals and the healthcare in general. What do? We take care of people. So when they see volunteering on anything on your resume, it's always good. We like that. That means the person is involved already with caring for people. It's all about taking care of people. So, va à la Croix-Rouge, trouve Red Cross, yes, Croix-Rouge. Oh, okay, Red Cross, yes. Va, Google Red Cross in Columbus, Ohio. Trouve-les. Sur le website, ils ont volunteering area, volunteering website. Donc, quand volunteering, ça veut dire bénévolat. Donc, tu peux te remplir les informations dessus. Mais si tu trouves leur adresse, tu peux aller directement sur place et puis leur dire que, hey, j'ai fait phlebotomy, je veux être volontaire et puis aussi en même temps vous assister et tout ça. Donc, si tu fais ça pendant un mois, ils peuvent te donner du boulot là-bas. Ou bien tu peux utiliser ça après dans ton CV pour dire que tu as fait quelque chose comme ça. Maintenant, par exemple, moi, hi Clara, thank you for being here. Je dois t'ajouter en retour, déjà? Ok. So, moi, par exemple, j'ai une de mes secrétaires qui a commencé en tant que secrétaire à l'hôpital. Pendant ce temps, elle est à l'école, elle fait la biochimie. En même temps, elle a fait phlebotomy. Maintenant, ils lui ont dit qu'on n'embauche pas les phlebotomistes. Nos tech font phlebotomy, ils font EKG, ils font tout. Donc, ils lui ont proposé de devenir tech et ils vont la former. Donc, ça aussi, tu peux faire. Tu peux chercher un travail de CNA quelque part où ils pourront t'utiliser en tant que phlebotomiste. Tu vois un peu. Donc, ça dépend seulement. Between EKG tech, pharmacy tech, and stereo technician, which one is better? Stereo technician will be the bomb because you will always find a job. Pharmacy tech will be number 2 and EKG tech will be number 3. They're all amazing, but stereo techs are always needed. It's like OR nurses are always needed. So yeah, you can start stereo tech. And guys, like I tell you every day, right? L'anglais n'est pas un obstacle, tu penses? L'anglais peut être l'obstacle. C'est pour ça, si tu fais le bénévolat, ça va améliorer ton anglais. You know what I mean? At 8 o'clock, wake up, Malika. Okay? Et donne-lui de l'eau. Si tu fais le bénévolat, ça va t'aider avec la communication et tout ça. Même si on te donne le bénévolat à la porte, à l'entrée, sur la table, moi, ce que je faisais, c'est Hi, welcome, did you fill out the daily pass and this and that? Et puis, je les aide et tout ça. Même ça seulement, ça va t'aider déjà. Tu vois un peu. What about dental assistants? Yes, dental assistants are very much needed as well. If you don't want to be cleaning the poop, dealing with patients and all the humor, you know, anxiety and stress in the hospital, you can do dental assistants. They're very much needed. They're very much needed. And also, guys, pharmacy technician. I have a friend. She mentioned on like under one of my videos that your CVS, Walgreens, actually they can train you as a pharmacy technician, but you have to stay with them, work with them. So such that you don't have to pay for a schooling for that. You can actually have a train. You can actually be trained in a pharmacy as a pharmacy technician for free, and then you stay and work with them. So look into that before you go spend money somewhere. Midwife, hey, 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 I love my midwives. Hey, hey, hey. So I'll say this in both English and French. So to become a midwife, right, you have to be a nurse first. You have to be a registered nurse first. You have to work with women for a year or two, and then you go for your master's in midwifery. That's how they call it. So you go for your master's in midwifery. And then after that, you're going to take the national exam to become a midwife. Donc, pour devenir sage-femme, je vous dis les amis, je sais que j'ai beaucoup de questions pour ça. Même si tu viens d'Afrique, c'est dommage, ils vont pas reconnaître ton examen, ton diplôme de sage-femme ici. Tu dois être infirmière d'abord ici. Donc, tu viens, tu fais si tu as déjà ta licence, tu peux faire les 1 an, tu deviens infirmière. Après ça, tu dois travailler pendant 1 an ou 2 ans avec les femmes, par exemple avec labor and delivery ou mother and baby. Quand tu finis de travailler avec les femmes, then tu retournes à l'école pour faire le master degree pour devenir sage-femme. Donc, c'est un peu ça, quoi. Yes, guys, keep tapping. For sterile processing. Non, j'ai pas, je peux chercher avec les gens de Level Up RN, là, ils sont bons. Dental assistant, I talked about it, l'anglais. Tu as rendez-vous Monday pour commencer les cours. Medical assistant. Hey, 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 I love that. Rappelez-vous, guys, YouTube, c'est un instrument très important. I used YouTube throughout my nursing school, and I was like, these people are putting out these videos for free. They should be paid because they are good at explaining. So watch YouTube videos, do your readings before you go to class. So 4 things before you go to class, guys. You have to, like, no matter the training you're doing, CNA, LPN, dental assistant, tech, sterile processor, all of that, you have to read. You have to know the material. Read your assigned book. Read your assigned lectures. Watch the YouTube videos on that subject that you're learning that week. Print out your PowerPoint and read those. Take notes somewhere and then go to class. That's how I studied. Go to class. I used to have a recorder. My school was okay for us putting all the recorders in front of the teacher. Put your recorder there, just sit and then take notes of things that are new, right? But listen to them. And then driving home or cleaning or when cooking, listen to the lectures again. That's how the information is going to stay in your brain and it's just going to sit there. And then when you're done listening to them and reviewing your notes, go now take your NCLEX style practice questions. That's it. You'll be good. You're not gonna suffer through nursing school or LPN program. Hygiene, dental, and registered nurse. Go for registered nurse. Registered nurse. You know, guys, if you ask me anything compared to registered nurse, I'll tell you registered nurse. Not because I'm trying to be biased, but just because it takes everything. And RN is everything. You know, doctors are nothing without us. I swear. Oh, during COVID time, right? They had residents, les résidents là, they had them come on our floor, help us out. So we had them taking vital signs, cleaning the patients and doing that. They could not survive. They could not survive. They were sweating, they were turning red. Just to tell you how nurses are important. LPN, very important too. I recommend for you to do LPN to begin with. I always recommend CNA, LPN if you have children, you want to start earning money quickly. CNA, you're in the hospital, you do LPN. The hospital pays for you to become an LPN. You know what I mean? So you're saving money. You're not gonna be in debt like I am, but I'm fine. I don't regret anything. But if you're in the hospital, you decide to become an LPN, they will pay for you to go to school. And once you graduate and you pass your NCLEX exam, you tell them, you call HR, hey, here's my license, switch me. They will switch you from CNA to LPN. And when you want to go back for RN, same thing, they pay for you to become an RN. Once you're done, hello, where's my money? That's it, they raise your money. The workload of the LPN versus an RN class, it's the same. It's the same because as LPNs, you're gonna take pharmacology classes. That's the basics. Like I say every day, your job as a nurse is to give medicine. That's your 50% of your job. 50% of your time, you're gonna spend it giving medicine. So you have to know what's happening, what you're giving to the patients. You have to know your mathematics, because guess what? Those computers will shut down sometimes. Sometimes we have downtime. Downtime means the computers are not working. So if they're not working, you have to give medicine. You have to know your math. Because them residents, I'm sorry, when they start, they don't know shit. They don't know anything. They will order anything and everything. And it's you, the nurse, that's giving, hello, friend user. Hi. Oh, Deirdre. Hello, sister. Thank you so much. Thank you for always being there, commenting, watching, crying with me. Thank you. So yes, them residents don't know anything. Between June and August, that's when they graduate. They start. They don't know. They don't know. Sometimes we're like, doctor, are you sure you want to order this for this patient? They're like, huh, what do you mean? I'm like, this does, have you seen the weight? Have you seen that? They're like, oh yeah, what do you recommend? And you, the nurse, you're going to recommend. So you have to know your pharmacology, because this is what's going to kill your patient. Cleaning your patient is not going to kill them. Them screaming or doing whatever is not going to kill them. It's the medicine. Vous savez, les médicaments de l'Amérique, comment c'est? It's the medicine that's going to kill them. So you have to know your pharmacology as an LPN and as an RN. So that's the most important thing that you do. So study those pharmacology, guys. I know it's hard, but it's worth it. Because when you know your meds, when you know your heparin drips, you know your insulin, you know when to give it, not to give it. As a nurse, you can say not given. Let's say you take your insulin, your sugars, it's 100, it's 80, and it's long acting. You like not given per nurse judgment. That's your judgment. You can decide not to give. Let's say you give your beta blocker, you have to give your cardiac meds. Patient's blood pressure is less than 100 and heart rate is less than 60. You're not given, right? Per nurse judgment, and then you communicate with the doctors. Hey, doc, I did not give the APM meds because so. and you document. That's what you do as a nurse. So LPNs and RNs, it's the same workload. And I feel like LPN will be more because you're learning everything in 1 year, as compared to RNs, it's 2 years or 4 years. So it depends. But it's all worth it. Hey Kade, thank you for the follow. My friend in Arabic, I can't say your name, but thank you for the follow. Really appreciate you. Mamadou, Lola, thank you, thank you, thank you, thank you. I love that. Is it 7 p.m. the time where everybody is online? I love that everybody is here. Solange, hey maman, je vais te faire monter là. Je dois te faire monter. Tu es là. Tu es là. Tu sais que maintenant je peux faire monter les gens. Mais tu n'es pas obligé de mettre ta vidéo. Mais je dois te faire monter. Is it gonna let me? Yes. Actually, I just sent you the invite, guys. So my sister Solange, hey. So my sister Solange, she's LPN. Are you at work? You can talk. On doit schedule cela. Maman, faut couper alors. Faut couper. But I wanted her to come up. So like I told you guys, I will be inviting friends around here. Aisha Sise, hi. Hi. So yes, guys, just stay focused. Thank you for viewing all of it. We can hear you. Is that me? Hi. No, it's not working. Okay, I'm gonna turn it down. But hey, yes, guys. Thank you. Oh, thank you, Buddy Brown. Really appreciate you. Ma Solange, on va programmer ça. Ok? On va programmer le live là. Together. Thank you so much, guys, for being here. So, questions. I'm still here. C'est quoi le test de tease? Attends. C'est quoi le test de tease? C'est à quel moment on fait le test de tease? Donc, tu prends le test de tease quand tu dois passer, quand tu as fini de prendre tes prerequisites. Donc, si tu as les prerequisites à prendre, les prérequis à prendre avant d'entrer dans le nursing school, ça peut être les mathématiques, ça peut être les pharmacology, ça peut être, pas pharmacology, ça peut être les mathématiques, ça peut être les sciences, ça peut être les English. Donc, quand tu finis de prendre tes prerequisites, je conseille then de prendre ton TEAS exam. Parce que le TEAS exam te teste sur le reading, le English, les maths et les science. Donc, si tu as pris tes classes de science, you'll be good. Si tu n'as pas pris, you'll still be good. Parce que si tu as ce livre-là, le livre de TEAS, là, le ATI TEAS, parce que le livre a été créé par les gens qui créent l'examen. Donc, si tu achètes ce livre-là, I'll go ahead and pin it. Donc, tu pourras passer l'examen. Ça te prend juste du temps pour étudier et pour comprendre. Surtout que tout est en anglais. C'est pas toujours évident. Tu comprends un peu? Hi, friend. Speak English. I know. I'll come back in English. I speak both. So hey, hi. Because you know I have my French people here and I have my English people. That's for sure. Hi. You already passed your CNA. Now you're in school nursing. Oh, I pray for you, T. Rich. You got it. You got it. Just go by. Like I said, read, watch YouTube video. Registered Nurse RN, she's amazing. Level Up RN, amazing. Nurse Mike on YouTube, amazing. Picmonic, amazing. So read your assigned readings, and then watch your YouTube videos. Print out your PowerPoint. and then try to record your teachers if they let you. And then once you get home, do your practice questions for your NCLEX and you will be fine. I promise. And if you can get this Saunders for NCLEX book, it's good for the entire nursing school. It's amazing. I love it. It helped me out a lot. So yes, good luck. You got this. Comment trouver un hôpital qui peut te sponsoriser? Les Américains ne sponsorisent pas comme ça. C'est ça le problème, en fait. Ils ne font plus cela comme ça. Tu dois avoir, comme je dis, si tu as déjà le diplôme au pays, tu dois passer l'examen à partir de ton pays. Comme ça, tu vas trouver le boulot directement. Tu peux venir. Mais sponsoriser ou bien les amis, si vous savez les sponsoriser ou bien si vous savez about les bourses et tout ça, allez-y, commentez comme ça. On pourra share avec nos amis qui sont partout ailleurs. I'm trying to, how do I get out the panel view? How do I get out? How do I get out of it? Someone can tell me. What language is she speaking? I'm speaking French. I'm speaking French. I'm from Congo and Cote d'Ivoire. So I speak French and I speak English too. So I have both people. And also I speak Lingala too. What language do you speak, friend? Thank you, guys. Keep tapping. We're almost there. We need to get to 30,000. You're from Somali. Hi, I have a lot of colleagues from Somali, and Kenya and Sudan as well. Bonsoir Aïcha, bienvenue. Guys, comment je sors de cet écran là? The textbook. So this is the Saunders book that I recommend for nursing school. You buy it, it's a one-time thing. It comes with 6,000 practice exams, guys. 6,000 practice exam questions. It's amazing. Love this book. It's just amazing. It helped me out a lot. And this has the new generation NCLEX questions. So yes, it's a one-time buy. It has, so it's the new generation NCLEX. It has 6,000 practice questions in text and online offer. You also have the clinical judgment boxes. You have flashcards. You have health problems with the codes and stuff like that. So it's a nice book. I love the book. It's a one-time buy that you keep for the rest of nursing school. You're from Cameroon. So for all my international people that are interested, so the only thing I can tell you is just to apply for the visa, for study visa, if you're not already a nurse. If you're already a nurse in your country, then you have to, go through the process to have your degree evaluated, pass the NCLEX exam. So that's how they hire international nurses. You have to pass the NCLEX exam from your country, and then the hospital will hire you. Today we just hired someone. She's from the Philippines. So yes, from the Philippines. She's Filipino, right? Comment vite apprendre l'anglais? Ben, la seule façon de vite apprendre l'anglais, c'est que tu dois t'immerser dans l'anglais. Du matin au soir, tu dois écouter le CNN, tu dois écouter le BBC, tu dois écouter le podcast en anglais, regarde les YouTube où on t'apprend les phrases, comment construire les phrases, comment faire le vocabulaire, les verbes et tout ça. Et aussi, il faut parler. Donc, va faire du bénévolat quelque part. Can you wake Malika? Va chercher Malika avec moi. So, you get to, va faire du bénévolat, Salvation Army or Salvation Army. Yeah, Avec Salvation Army, tu peux faire du bénévolat. Avec Goodwill, tu peux faire du bénévolat. Avec la Croix-Rouge, tu peux faire du bénévolat. Va là-bas. Moi, je partais là-bas 2 heures par semaine. Tu es dans la cuisine, tu prépares pour les sans-abri là et tout. C'est comme ça que tu apprends l'anglais rapidement. Tu dois toujours être dans un endroit qui parle l'anglais. Et tu dois arrêter de parler le français. Ton ordinateur doit être en anglais. Ton téléphone doit être en anglais. That's how you're gonna learn. Le PN programme est très intense. Mieux vaut ne pas travailler si tu veux faire ça. Tu peux t'organiser. Par exemple, j'ai une amie qui nous a dit la dernière fois pendant le live, elle dit, ah, moi je savais que nursing school, ça allait être dur pour moi. J'ai demandé à mon oncle si je peux rester dans son basement. Si tu as la famille, si tu as les gens pour réduire tes dépenses, yeah. Mais les gens comme nous, on n'avait personne, on n'a pas la famille, on n'a rien, tu as les enfants, qu'est-ce que tu fais? Ben, tu dois travailler, tu dois sacrifier le sommeil. Je dormais 3 heures, 4 heures par nuit, par jour. C'est ce qui me suffisait. You gotta do what you gotta do. Tu vois un peu. Si tu peux afford ne pas travailler, c'est bon. Mais maintenant, si tu dois travailler pour t'occuper de ta famille, then tu sacrifies le sommeil. Donc, c'est un peu ça, quoi. Guys, comment je reviens au normal? Parce que je suis sur le host et je n'aime pas comme ça. Oh. Ok. Ok, je crois que je vois Django. Ah, ça me ramène encore. Désolé, désolé. I'm trying to figure out something. Non. Oh, je dois fermer le guest. Can I use English, please? Jebby, I use both. I use English and French. You ask me a question in English, I will answer. And if you ask me a question in French, I will answer as well. You know, most of my subscribers here are from a French background. Actually, like 75% of the people here are from a French background. So yes, I respect that. So if you ask me a question in English, I will answer. But I try to do both, okay? The link for the site where you get all the informations. Which informations are we talking about, Breezy? Is that for... Bonjour madame, tu peux m'expliquer si elle est... You see that taxi? So yes, I don't know what language you guys are speaking. Thank you, Miss Solange. Miss Solange is answering. So yeah, you can work and you can do both. Actually, you can be in nursing school and have a job. The ideal is not to have a job, but then again, we're from Africa, guys. We can do it. Like, we can do it. If you have no choice, you have bills to pay, what do? You gotta do what you gotta do. So yes, Mama, thank you. So, CNA Certified Nursing Assistant, c'est aide-soignante. Donc, tu aides la nurse, tu prends les signes vitaux du patient, tu l'aides à manger, tu les aides à les changer, tu les aides à se déplacer du lit à la chaise, partout. Donc, tu aides vraiment à l'hôpital comme dans les maisons de retraite. Sorry guys, if I'm looking this way, I'm live on YouTube as well. So all my friends, go check out your girl on YouTube, okay? We just got started. I need 1,000 of you. That's all I need. Thank you for the tap. Guys, keep tapping. below our goal. We're almost at 12,000. Last time we were at 30,000 by the time we were done with the live. Dango. On how to come to the US to work as a nurse. Okay. So the website is called GSFSN. TikTok would not let me share anything, so you have to message me so I can find the website for you. But anything outside of TikTok, I cannot share during my live, or I'll be in trouble. So message me and then I can send that to you. Eh, ma soeur, faut pas te laisser te décourager. Oh. C'est ça mon palabre tous les jours. Tous les jours, c'est mon palabre avec les gens qui découragent les autres là. Ne laisse personne te décourager, maman. Faut pas laisser quelqu'un te décourager. Comme je dis tous les jours là, ton expérience, c'est pas l'expérience de l'autre personne. Moi, je suis partie à l'école avec des amis. On était en train d'étudier ensemble. Mon meilleur ami, à part André, j'avais un autre. Mon meilleur ami, il est de Madagascar. On étudiait ensemble, on faisait tout ensemble. Il n'est jamais devenu nurse parce que c'était difficile pour lui, c'était ci, c'était ça. André, on souffrait. J'ai ma soeur togolaise. Donc, ton expérience ne sera pas l'expérience de l'autre. Et nous, on a étudié au pays, donc on sait comment étudier difficilement. C'est la langue seulement. Et moi, je dis toujours aux gens, quand tu arrives, il faut avoir la détermination. J'ai des petites nièces ici, elles m'appellent toute Tata. Elles ont 18 ans, 19 ans, elles viennent d'arriver, ça fait même pas un an, elles me font, Tata, je veux faire le nursing, je veux ceci, je veux cela. Right? J'ai des jeunes garçons aussi, 18 ans, 19 ans. Ils sont en train de faire CNA. Je suis en train d'étudier avec eux. Je suis en train de leur apprendre des choses et tout ça parce que je fais le coaching et puis j'ai le CNA Academy. Donc, j'étudie avec ces enfants-là qui viennent d'arriver. Ils n'ont personne. Mais tout ce qu'ils veulent dans leur tête, c'est aller à l'école. Ils n'écoutent personne. Maman, même si tu échoues une classe, tu vas reprendre la classe. Ici aux États-Unis, si vous avez regardé l'histoire de ma copine Suzanne, ma collègue Suzanne, elle a fini le nursing school à 53 ans. Elle a 8 enfants. 2 étaient déjà grands, elle avait 6 avec eux. Elle vivait dans les aides gouvernementaux. Elle s'est dit, ça, c'est pas la vie que je veux donner à mes enfants. Elle vient de la Jamaïque. Donc, elle a commencé, elle était CNA pendant 10 ans. Elle a décidé d'aller au nursing school. Elle a fini à l'âge de 53 ans, s'il te plaît. Ça fait 1 mois qu'elle vient d'acheter sa maison. Une grande maison comme ça. Elle dit, Nancy, mes enfants m'ont pleuré comme ça. On dit, oui, finalement, chacun a sa chambre parce qu'ils n'ont pas connu cela. Tu comprends? Donc, pour te dire que ton expérience ne sera pas l'expérience de l'autre. Et elle travaille 5 jours par semaine. Nous, on fait 3 jours, on est fatigué. Elle fait 5 jours par semaine. Donc, pour te dire que faut pas écouter les gens. Les gens racontent des bobards. Les gens parfois sont jaloux. Ils voient que si tu fais des études plus que tu vas réussir. Il y a quelqu'un qui a dit à mes amis, toi, tu viens de débarquer là, tu es là, anglais, 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 école, école. Si nous, on n'a pas fait, c'est toi qui vas faire. Mais aujourd'hui, mes amis là sont ingénieurs informaticiens, ils sont ingénieurs ceci, ingénieurs cela. Et ces gens-là sont toujours là au même niveau. Donc, n'écoute personne. Hi, Makar, I'm doing fantastic. How are you? Hi, 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 hi. I will answer. Give me 3 days. It takes me about 3 days to answer my messages because I just get that many messages and I try to respond to every friend. Hi. So, my YouTubers, I'm here. I'm keeping an eye on that too. You can ask the questions. I will answer. Okay. I'm doing great. Oh, so Macau says they provide surgical, dental, orthopedic, beauty care, instrument manufacturers, exporters. Okay, thank you for being here. Thank you for following. Thank you, thank you, thank you. I love making new friends. Love making new friends. So guys, si tu es déjà dans le nursing school, okay, most of my friends already have this. So you have the quick fact for med surg and pharmacology. Like she never fails. She's the bomb. Like anything quick fact, Go for it, guys. She makes it easy to understand and to remember, okay? Because that's the thing. The thing with nursing, you have to understand and be able to remember. Understand first. Why are you doing this or that, okay? So, quick facts. Amazing. So, you have one for the NCLEX and one for the HESI exam. TEAS and HESI together. Miss Laetitia, if you are here, je te conseille de prendre this one too. I know you got the HESI book. I want you to take to get the quick fact too for the HESI. So she is amazing, you know. She just gives what you need to know, because nursing school books will give you a lot of information and sometimes you don't need most of them. So that's why we're here to tell you what to get, what works for us. Okay, quick facts. All the quick facts are the bomb. If you, depending on where you at, you thinking nursing school, your school wants the HESI or the TEAS, you have the quick facts for the HESI and the TEAS. If you're done nursing school, you have to get the quick facts for nursing school. You have to know all of this. You have to remember all of this. These are the most tested things in nursing school. Okay, and then if you're taking med surg and pharmacology, check this out. Very recommended, highly recommended. Kaplan exam. Which book is good for Kaplan? If it's Kaplan, just check the Kaplan books. You know what I mean? You want to take, you usually, it's like for the TEAS, it's ATI. For the HESI, take the program, you know, the company that makes the exam. Take the book. That's, thank you for the daily heart, me. Appreciate you. Just get the book, because they're gonna give you the essentials that they actually test on. They want you to know that. So if it's in the book, that means you have all the chances to be tested on it. So if it's TEAS, get the TEAS ATI. If it's HESI, get the HESI book. That's right here. So that's how it works, guys. You just want to go with the company. That's how it works. Emmanuel, thank you. Oh, thank you for joining my club. You're welcome, Emanuela. Thank you, sis. Thank you for being here. It's a pleasure to be here and share my knowledge and my passion about nursing. I love doing this. I think I will go into, I don't think I knew that I would retire into nursing, like teaching, become a professor. That's what I want. You know, I want to be driving my Tesla to work, to school, to work, and wear my heels at 60 years old. And guys, the good thing with nursing, there's no age for retirement. We have the oldest nurse on our floor. She's 75 years old. She's been a nurse for 35 years. Okay, she's 75. She's tired. We feel so bad for her. We're like, you can go ahead and do home health care. You know that, right? And just go visit the old little people, talk to them. But no, she's still bedside doing med surg, fighting those young people. I'm like, you can be that grandma. Why are they fighting us? She does not, she does not like to be called grandma, but she's old. She's 70 plus. Just to tell you, with nursing, there's no retirement. Like when I'm 60 plus, I will sit somewhere in the Bahamas and be teaching online and all of that. That's a cool thing with nursing. Je t'envoie le message. Ah, ma chérie, je t'enverrai le message. Faut pas t'inquiéter, j'ai écrit ça quelque part pour ne pas oublier. Ou bien si j'ai pas répondu, il faut juste commenter sous une vidéo que je upload. Si je poste une vidéo, il faut juste commenter, comme ça je pourrais t'envoyer le message, okay? So yes, guys, nursing is amazing. You start somewhere, and then the coolest thing, right? You start somewhere in the hospital, and then you can switch. If you start med surge, I have a lot of people starting med surge and then going to ICU, or med surge and they do mother and baby, and then they do labor and delivery, and then they go to ICU, and then you go outpatient. You can just work with insurance companies. You become case manager, and now they have triage nurse. Tu travailles à la maison, tu es triage nurse. Les patients vont t'appeler. Oh, je me suis cassé le doigt. Oh, je me suis blessé ici. So you get to tell them where to go. Wait, tomorrow you're gonna go to your doctor. And my hospital right now has um, admission nurses. Tu es assise à la maison. When the patients come, you put your video on and you admit them, and then you write down in the computer all the information and tout ça. Don't, it takes off some workload on us nurses at bedside, and then we have nurses at home that are helping us. You know what I mean? And now with psych nurse practitioners, they all work from home. You know, they see the psych patients. They prescribe the meds. They have, you know, those consultations through videos and stuff like that. So you get to be a nurse and do so much to be done in nursing. You don't have to stay on in one unit. Adoni, you want to take your TEAS exam? Oh yeah, you can only get the TEAS book. Yes, yes. Um, yes, the ATITs, that's all you need. You need the book. It comes with 8 exams. You have 1 test in the book and 7 tests on the computer. So you get used to how to take the exam. Okay? Yes. Hi, lady. You're going to be studying. Thank you so much. Thank you, thank you. Thank you for the follows. And then it has more than 1,300 video answers explanations. So when you miss a question, you don't understand what it means or what it is, you can watch a video explaining exactly why did you miss the interstitial tissues, why did you miss, you know, the oxygenation in the heart, the blood gas, all those good stuff. It explains to you. You also have online flashcards. So you have 50 lessons modules and 100 video modules. Just remember, when you get the book, you have to scan, there's the QR code somewhere. You have to scan the QR code, and that's going to prompt you to have the online access. Okay? So just remember to do that. So the online access, you will have the flashcards, you will have the videos, you have everything that you need to be studying for your TEAS exam and be successful. So it's here. The first page tells you to access online resources, follow these instructions, go to the website, select register book, register your book, and then follow the instruction. And every book comes with a number, so they're gonna ask you a number. Just keep the number so you can have both online and the paper book as well. Okay, thank you for follow, guys. Keep tapping, tapoter the screen. So at least that, right? I've been talking a lot for what, almost 2 hours. I still don't know how to bring my thank you so much, guys. Really appreciate you. I still don't know how to bring completely my screen. Oh. Let's see. Thank you so much for the roses, guys. I appreciate you. Thank you, thank you, thank you. Hello, lady. Hi, Ramatuli. Is that how you say your name? That's so cute. Hi. Okay, my guys. Thank you so much for my YouTubers. Jirinu, you started nursing in January. What are some good advices that I have for you as a first semester? So, as a first semester, I know you're gonna sweat a lot. I need you to take a deep breath, okay? And tell yourself we've all been there. We've all struggled in nursing. But here are the things that I need you to be doing. Make sure you have time to do your lectures. You have to read before you get to class. Like, you cannot bypass that. So do your lectures, assign lectures, read your books, highlight them. I used to highlight all my books, like all the essential information. Highlight your book. Watch the YouTube videos. My top number 3, registered nurse RN, level up RN, and then simple nursing with Nurse Mike. Watch those 3 people. Just type the subject. Let's say you are working on the cardiovascular system. Let's say you are working on PEDS. Let's say you're working on your ABGs or your electrolytes. Just type whatever electrolytes you're working on, and then find those 3 people. Watch the video. One video is fine. Read and then check your PowerPoint. And then once you get to class, just listen to your professor. If you can record your class, your lectures, that would be good. So once you get home, you can listen to them. In the car, you can listen to them. That's very helpful to record your lectures. And then have a study group. Have your friends that you're studying with, because you remind each other things. And remember to stay organized. You need a planner. You need a planner where you can put down all your due dates, okay? All your due dates. You need to write down your due dates so you won't forget. But don't forget the clinical parts. You have to go to the lab and you have to go exercise. You have to go actually work on those mannequins. So do your head to toe assessment with your friends. You will find professors there that are there to the open labs just to teach you. Also, guys, don't forget to go see your professors on the open hours. They will tell you things. They will give you secrets. They will give you sometimes exam questions because they talk too much, and then you might get some exam questions there. So that's how I started. I used to make flashcards. I used to write down on flashcards. It took me forever to write down, forever. But now you have these flashcards. For example, this is pharmacology and this is EKG. So you want to get these and start studying. You can have them on your phone and you can have them here. And Quizlet, guys, don't sleep on Quizlet. Quizlet is free resources. And also, last thing, do your practice exams. Do your NCLEX practice exams every day. Do at least 10, 15, 20. It does not have to do anything to do about what you're studying at that time. Just keep doing your practice exams. You will learn. Your brain gets used to prioritization questions, select all that apply questions, and you want to read your rationale. Why is the wrong answer wrong? Why is the right answer right? So that's how you succeed in nursing school. Salut Rama, comment tu vas? Pour débutants en anglais, pour nurses, si... So, pour les débutants en anglais pour nursing, bon, je recommande celui-là. C'est le Saunders Book. Celui-là va te suivre pendant toute la formation de nursing. C'est un bon livre à avoir. Et puis, ça va t'aider à savoir comment lire, comment comprendre, comment avancer petit à petit dans le nursing. Donc, Je les pin, tu vas le voir. C'est le NCLEX Aaron Saunders. Nice book. Tu achètes une fois et tu gardes ça pendant les 2 ans, 3 ans, 4 ans de nursing school. Hey, Vanessa, where have you been? Were you at work? Hello, beautiful. Thank you for being here. Can you start? Thank you. Thank you for always being here, Vanessa. Can I start LPN class while I have my high school diploma? If you have high school diploma, your high school diploma, yes, that's a requirement. You have to have a high school diploma or GED to be able to start your LPN school. Yes, and it's guys, some LPN schools are 10 months. After 10 months, you are a nurse. Like seriously, vous n'avez pas d'excuses, guys. Si tu essaies que ça marche pas, tu auras appris. C'est l'expérience que tu auras, right? Tu essaies la première fois, ça n'a pas marché, tu auras. Where's my life? Bon, qui va t'occuper de le s'il te plaît. You know what I mean? Once you get the experience, une fois ça va marcher. Ma copine Suzanne, là, de 53 ans, 2 fois, elle a échoué. Et puis, elle a réappliqué encore à l'école de nursing. Je vous dis, guys. Parce que ce que tu gagnes en une année de nursing, ça dépasse ce que les gens gagnent en 2 ans, 3 ans, en temps normal. Et je vous dis, les gens vont être jaloux de vous comme ça quand vous devenez nurses. L'argent là, ça va dans les taxes, mais ils pensent que this and that. 9 months in New York City, tu vois ça? Miss Solange says that LPN in New York City, it takes 9 months. Only 9 months for you to become a nurse, guys. Et Miss Solange, en New York City, c'est combien le base pay for LPNs? Donc, on peut essayer le tease plusieurs fois. Oui! Donc, j'ai appelé pour une amie que je coach là. Son école a dit tu as 3 essais dans l'année. 3 essais dans l'année. Donc, chaque 2 mois, donne-toi 2 mois pour aller étudier. Tu vois un peu? Oh, Miss Solange. Oh, you think 35. Urisuma Berry. Hey, ton nom là-dedans. Urisuma Barré. C'est de quel pays? Urisuma Barré. C'est pas le Sénégal, right? Guys, 35 dollars LPN à New York, tu t'amuses? Mais ça, c'est ce qui commence, les nurses à DC, ça commence à 36 dollars. You see this, guys? So, there's no excuses. In 10 months, you become a nurse. Because LPNs are nurses. And most of LPNs that have so much experience will tell nurses what to do. We tell doctors what to do because you have that experience. You just know what to do. You know? $35. That's without overtime. Overtime is time and a half. So 17.5 plus 35. So you're almost at $50 an hour. True, right? Yes. I was taught stuff by my CNAs. Like as a new grad nurse, how to change a colostomy bag, how to really clean a patient, how to insert a Foley. My CNAs could not insert the Foleys in my hospital, but they were teaching me how to insert the Foleys. Just you know, thank you so much, love. Just you know, you have to respect your CNAs, Emanuela. Yes, those mama. So I had one from Jamaica, one was from Haiti, one was from Africa, from Mali. Hey, those mama knew stuff, and one was Black American. So they were like, come here, let me teach you something. You have to be nice to them as a new grad. Be nice to your CNAs. They either will help you out or they will mess your job out. Because if they mess you out, they will be hiding. You can't see them. And you're going to drown as a nurse. You cannot do everything by yourself. Just, you know, so respect your CNAs. Show them love. Buy them some Panera bread. But Panera food. I used to cook. I love cooking a lot. So I'll cook a lot of food and bring it at work. So all my CNAs loved me. Yes, guys. So, yes, nursing is a team, it's a teamwork. As a new nurse, I swear, they give you so many tips. Those mama CNAs, they're really good. Really good. Some people will give you hard time. C'est comme ça. Il y a des gens, juste ils te voient. Il y avait une là, quand elle me voit, elle est fâchée jusqu'à demain matin. Et c'est la vie, c'est comme ça. Faut comprendre, c'est partout. Comment les gens me disent, ouais, CNA, non, nursing, il y a les bullies, il y a les racistes, il y a ceci. Il y a le racisme partout. De quoi on parle? Moi, je travaillais dans un restaurant. Il y avait les racistes partout. Quand je venais d'arriver, j'étais à l'université, je faisais accounting et puis je travaillais dans le restaurant de l'université. Quand je parle, les gens disent, ah, what did you say? Can you speak English? Tu comprends un peu? Donc, il y a le racisme partout. Ça, c'est dans le restaurant. Je gagnais combien? 15 dollars à l'heure? Maintenant, tu vas me dire dans le nursing où tu as presque 50 dollars à l'heure, quelqu'un va se jouer les cons avec toute la connaissance que tu as là. Ça va te faire mal au cœur, ça va te faire détester ton travail. Non, je suis désolée. Personne ne va me faire changer d'avis sur le nursing. You know what I mean? So keep going, guys. Don't listen to anybody that tells you, well, nursing is hard. Everything is hard. Working at McDonald's is hard. Working in a warehouse is hard. Doing Uber, very hard. Your back hurts. There's no job that's not hard. Everything is hard. But then again, the hard and the money. So we always say it's hard, we suffer, we stress. But then again, on Friday when you go to the bank, you're happy. Okay? So everything is hard, especially in America. There's no job that comes easy. So don't listen to anybody telling you, well, nursing is hard. I don't want to, but they're still nurses and they tell you, oh, I won't recommend you to do nursing. Why did you not quit? You can quit and go do something else. Just go ahead. Miss Keisha, thank you, my love. Thank you so much. Thank you. Oh, my BSN RN students are here. So how's it going? What semester are you in? Kayla, yes, sisters. Let me tell you something. Nursing is hard. Everything is hard in life. But then again, once you're done that code, you're done resuscitating a patient, you find the pulse, and then you send them to ICU, and then you know they are alive. You feel good about yourself. Every job out here is hard. Even people that do Uber, they have rude customers in their car. That's their car, and you have rude customers. So it's hard everywhere, but nursing is worth it. It's very much worth it. Do you think doctors, even doctors, do you think that most of the time it's fun for them to be doctors? It's not fun. So I hate when people come and sit here, oh my God, I hate nursing, I don't like nursing, blah blah blah. You can quit or switch. That's the good thing with nursing. When you start somewhere in nursing, in that same hospital, you can switch 5 times. If you don't like med surg, you can do ICU. If you don't like ICU, you can do labor and delivery. You can do mother and baby. You can work with peds, with the little ones, if you feel like the old ones are just annoying and they are rude. You know what I mean? With the peds too, you have patients, the family members that are really rude. So it comes with what it comes. But then again, that paycheck, once you get it, you're happy, you forget about nursing. You know what I mean? And you have patients that are so grateful, you know. When I go home in the morning, my patient sends me a nice thank you card. Nurse Nancy, thank you so much for this and that. Hey, Hassa, you know what I mean? It makes me happy. It makes me happy. I have a patient family that came. The granddaughter was like, what did you tell my grandpa? Because since he left, he got home. He said, no, you don't do that way. Nurse Nancy said, I check my sugar like this. Nurse Nancy said, I eat this. You know what I mean? So that's, you're impactful. You impact people's life. You teach them. You are, you know, they look up to you. They think you know it all. They like you more than they like the doctors. To your exam. You're not ready? What exam are you taking? Tell me. What exam are you taking? So yes, those patients like you more than they like the doctors. because you are there with them. You cry with them, you help them out in the hardest time, you hold their hands, you listen to them. Some don't, sometimes I have patients that don't even get much meds. So I go there, I sit with them, I just listen to them. That's therapeutic to them. So you have to understand what works for your patient. One would be crying maybe because they're in pain, so that's the most important. Some would be acting confused, getting out of bed just because they want attention and they want you to stay there with them. So if you have time, when I have time, I go hang out with my patients. We can watch TV and I will be charting, you know? That's allowed. So you change lives, guys. You change lives. So taking care of human beings is not easy, you know, especially in this America. They sue you for anything. So that's why nursing school is hard, because you are learning, you know, you're learning meds, you're learning to take care of patients, you're learning to figure out what's critical, what's not critical. If your potassium is 5.5, it's 6, what do you do? If your potassium is 2.2, what do you do? You know what I mean? So you know all those things. What's critical labs? What to do as a nurse? Because lab will call you and tell you we have a critical potassium of 2.2. You know you have to run and start replacing those potassium IVs like no other, and you need the biggest gauge of IV. That's your job, because you have that. It's PRN. It's there. It's ordered. You know what I mean? So you have to know all these things because it's people life. Hi, babe girl. It's so important. I swear, I never knew that. Especially my old patients, they just like, Nurse Nancy, hold my hand. Just holding their hands, they feel good. They will start being confused and trying to jump out of the bed. Sometimes they will tell you, don't leave me alone. So I will send my CNA. If I don't have time, I will take turns. You know, they want companionship. So that's you're the nurse. You think critical thinking, right? You're not doing much for them. They just need that companionship. So every time you can, I stop by, I chit chat with them, I chart while we're watching TV, we're talking about stuff. They need that, because it's scary to be in the hospital. It's scary to think that you are dying, you know? It's not easy. But yeah, all of that is those are the aspects of nursing, and I love nursing. I need more. We need more of nursing, of nurses. Yes, guys, keep tapping. What else can I tell you? What else can I pin here? Oh, and yes, when you're starting nursing school, you need your compression stockings. Oh, thank you so much. Thank you for the roses. You need your compression stockings. I don't know about you all. Miss Solange, thank you, Mama. Oh, I love the love. Thank you. You need your compression stockings. Your feet would thank you. Your body would thank you. When I started, I did not know this, so I would wear regular socks and go to work. My preceptor was like, hey, you're going to kill yourself. Go get your compression stockings. So check out these compression stockings. Important for clinicals, important for when you start as nurses. I believe they have 6 pairs for $17. Really cool. Really cool. So I try, when you put a smile on your face and patient too. Hey, babe girl, why are you thinking like me like that? You know, someone told me, a patient told me during COVID, she looked at me. I had the mask on and everything. I had my cap on, everything. You know, she looked at me. She's like, Miss Nancy, keep smiling. It warms up our hearts. I'm like, how do you know I'm smiling? She's like, even through that mask, through your eyes, I can tell that you're smiling. You see how profound that is? We all have issues. You guys have seen me crying here. We all have issues. I tell my nurses, keep your problems in the car. If you can't keep them at home, keep them in the car. When you come to the hospital, you wanna be a good nurse, because put yourself in your patient's shoes. It's scary to think that, oh, you're 53 years old and they find that you have metastatic gallbladder cancer, or you have breast cancer that's met to the brain at 52, at 56. So these people are battling all type of emotions in their head. Even the husband knowing that the wife is dying soon, the kids knowing that mom is dying soon. You know what I mean? So it's a lot. Put yourself in their shoes. Just a smile makes a difference. I swear, I promise, guys. So keep a smile on. Even with the mask, they can tell that you're smiling. When you show them that they are annoying you, they can tell that you're showing them they're annoying. And then if they were bad, they will be worse to make your life miserable. But if you try to understand them and work with them and just explain your patient, explain them, hey, I have 5 patients. I will be here as much as I can. You know, you have those needy patients that will call you every 30 minutes. And then when you go in the room, you spend 1 hour. You have those. But there's a way of handling them. Talk to them, communicate with them. You can be passing by, you just stop by and be like, hey, hi, just saying hi. I'm going into a patient room. I will be back. They love that. They love being seen. And a patient told me that thank you for taking care of me as if I was a human being. You know what I mean? So these people go through a lot. Especially avec les Noirs de ce pays-là, c'est ceux-là sont avec leur attitude et tout ça. But ce qui est bien avec nous, on sait comment. We're nice. We're sweet. Hi, Chris. What's up? Hi, family. Thank you for joining. I need few nurses to come up here. I'm tired of talking, and I know friends here have questions. So come on, come up and share your experience with us. I know I will be planning those before my lives. This is my third live, so I never knew that. Yeah. So my nurses, let me know if you want to come up. I can bring you up so we can, share our experience with most of the viewers are nursing students, CNA students, future nurses. I just want them to see the positive side of nursing because they hear so much horror movies and stuff like that. Moussa Keita, bienvenue. Salut, salut, salut. Thank you so much for being here. Yes, yes, definitely. I hate that. And I hate when nurses are mean to patients. But we always talk about patients being mean to nurses, but nurses can be mean. You know, I will um, I will give reports, go home and come back, and the patient will be crying. She'll be like, "Hey, this nurse, so and so did this and that." I will run and advocate for my patient to the charge or whoever, and I'll tell the nurse, if you don't want to do this job anymore, you can quit and go do informatics. Nurse informatics, you don't even have to deal with human beings. You're on the computer all day and dealing with computer issues for nurses, so you don't have to. The day I get burnout, I will be gone because I don't want to give that bad taste to my patients. It's just that, come and smile and be grateful to have a job and to be a nurse, and be grateful to change lives, and save lives, that because that's what we do as nurses. So yeah, that is so true. Thank you so much for the new friends that are here. We have 15 minutes left, guys. I've been talking a lot. We have 15 minutes left. Thank you, thank you. I will try to make every Wednesday a day where we meet up. I go live and, I give all the infos that you guys need. And also, if you still need more infos, you can message me. Connection. Thank you, thank you, thank you, thank you for the daily heart me. Yes, so we have 15 minutes. Thank you for hanging out. Please check out the YouTube. It's the same name as the TikTok, Scrub Life with Nurse Nancy. Go ahead, and just support your girl. Paper semblant, so I love, 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 love this community, guys, that we're creating. We have people from everywhere, all over the universe. I love that. It's not only my French speaking people, it's not only my African nurses, my African sisters, we have Asian, we have people from everywhere. I love that. Love that. Thank you so much. Thank you. En tout cas, je suis là si vous avez des questions. Ah, tell me you can come up for maybe 15 minutes. Oh, she's gone. She's gone, she's gone. But yeah, I will plan lives so you can have different nurses that are doing different things, because nursing is so vast, guys. There's so much. Il y a tellement de choses que tu fais dans le nursing. Tu travailles avec les enfants, tu travailles avec les vieux, tu fais l'esthétique. That's what I want to do in few years. Nurse aesthetic, tu vois. You don't have to stay bedside. You start bedside, you get all the experience that you need, you give your best, and then you can switch. But you still keep your license. You can have 1 day PRN where you go to the hospital, you still take care of your patients, you can be teaching, do clinicals, bring student nurses to clinicals. My hospital has this thing where nursing schools will contact us to just orient students to the hospital. So what they do, let's say on Wednesdays, I have my nursing students. They will come with me at my hospital on my unit. So I know the unit, I know everything. So I just bring my students there. I teach them whatever they're learning. Head to toe assessment, how to take care of patients, how to administer meds, how to do the care plans and stuff like that. So you are still at work and you have that side hustle. Private or community college? Community college heads down, because private schools baby you guys too much, and then once you get into nursing you get that shock. Oh my god, it's so hard. Community colleges, they will show you how difficult nursing is. So once you are done with community college, any hospital they send you to, you can go and work. So I always, and you will see the difference. You can tell the difference between our nurses that are coming from private school and us that went to community college. You are ready to go. You're ready to roll. Um, Studying for the T's and HESI. So for the T's, I have two books, right? So this is from ATI T's exam, and also I have the HESI A2 book. So here. Sure thing, Kayla. Sure thing. Community college hands down. I love community college. Maybe because I went to community college, but then again, my managers and almost everybody will tell you that will take community college graduates over private schools, because private schools, they want your money. You're paying expensive, they want your money, so they will baby you. They won't show you the difficulty of everything. So that's why you have those nurses, they come, they're all shocked. Oh my god, it's so hard, I'm gonna go do high outpatient. No, community college will show you what's up. Okay, so you will start there, and the stress will start there. So I love community college. If you can choose, go to community college, and it's cheaper. It's cheaper to study in a community college compared to a private school. So yeah, community college it is. Thank you, Kayla. I think I said it. We talked about almost everything. We talked about how to study. We talked about the ABSN program. If you already have any type of bachelor degree, you can go for your accelerated degree in nursing. You can do that for only 1 year. I also recommend for my mommies, my parents, out there. You can start as a CNA and do your LPN program and then bridge LPN to RN, because as LPN you're already a nurse and it's going to take less time for you to do nursing school. So LPN, and then after that you can go for your RN degree. Okay, and then we also talked about the midwifery program. So you have to be a registered nurse for at least 2 years, work with women, and then you can go for first time here. Welcome, daughter of God. I know you've been commenting. I know you and I have been interacting somehow. Thank you. Thank you for being here. Welcome, welcome. And thank you for the follow. Hi, Barbie, Becky. Thank you, sis. Oh, I love my sisters. All my sisters. My guys, too. My brothers. I like you, too. But I love my sisters because sisterhood is stronger than ever. Because your sisters, they got you, they got you. When you cry, they cry with you. Thank you for being here. So, yeah, we talked about midwifery program. We also talked about how to study nursing school. You want to have a group study. Some people don't like group studies. I understand, but you don't always have to study together. You can have a group chat, a WhatsApp chat, a group chat where you just remind each other things that are due, or you share information. It's very important because nursing, you can't do it by yourself. Nursing school, or even when you become a nurse, when I see people acting all full of themselves as nurses, I'm like, wait, nursing is gonna humble your ass. And nursing always humble your ass, because when you get that rapid response, when you get that cold, you need people to be giving CPR, giving medicine, giving oxygen. You need everybody. So then your ass will be humbled. You're a nurse student at community college program. How to study for exam. Um, Nothing comes. Okay, so are you using any type of question banks? I need you to do practice exams. Very important. Practice, and what do you use for your practice NCLEX exams? You need your practice. You need to do practice exams every day. You need to be reading all your assigned lectures. Read all of it. So what do you use? Because there are a lot of question banks out here. So you have Saunders has question banks, ATI has question banks, UWord has question banks, nursing, Simple Nursing has question banks. You have to have question banks. When I say question banks, it's like 1,000 questions, 2,000 questions, 6,000 questions. So you have to have those. I have my number 1s, 2, 3, and 4. You can message me. I will recommend them to you. You have to do question banks. You have to teach yourself things or teach someone. That's why group studies are important, because you can be teaching a concept to someone. If you're doing pharmacology, you have to know what the medicine is doing in the body, which part of the body that medicine is doing. Too much of that medicine and too little of that medicine, the side effect, the patient teaching, and all of that. So you have to be doing, you're using Archer. I never used to use Archer. Oh, Cecilia, Archer works well. Great. I use UWord, I use ATI, I used even registered nurse RN on YouTube. She has question banks. Just do as many question banks as you can. And then I used to make flashcards to remind myself stuff. But now you don't have to write all of that. It took me nights to write things. So there are flashcards that are recommended, like from pharmacology, for your heart rhythm. She also has for fundamentals. She has a lot of flashcards that she's recommending. So do flashcards, do your question bank study guides, have study guides. You have to pay for ATI or it's free. If your school uses ATI, it's going to be free. If your school does not use ATI, you're going to have to pay for ATI. But let me tell you, your NCLEX questions will be just like ATI questions. I did UWord. UWord is next level difficult, but it's good because when I took my NCLEX exam, the computer shut down at 75. It was COVID. Now it's 85. At 75, it shut down. I was all stressed out because the questions were so easy. I was like, what the hell? I fell. Oh my God. But no, they make it harder so you can pass easily. So do practice questions, any practice questions, even Quizlet. Quizlet has good practice questions. Go to Quizlet, get those flashcards. Do that. Watch YouTube videos and write down the most important things. And then, go back to your PowerPoints. I used to record my teacher, so when I'm at home, I will listen again and highlight the most important things that they are talking about. And go to your professor's office hours, guys. Those guys will give away some exam questions without even knowing that because they talk too much. They're passionate. It's just like me. I've been talking for 3 hours. They will tell you everything they know. Which one is better to start? LPN or I would say depending on life situation, right? If you're already a parent, or if you life life requires you to have to work quickly and have money, you can do LPN. Because LPN in New York they pay $35. Can you imagine an hour? So you train for 10 months and you get paid 35. Overtime takes you to $50. And you're already an RN, or you're already a nurse as an LPN. There are just few meds that you can give. You can give blood products, and for some hospital you can give IV push meds. That's it. But you do everything else the RN does. So depending on you, if you are young, you're 19, you're 20, in your 20s. If you're young, you have time, do that. You can directly go for RN. It's cool, and then you can be working as a CNA, and also you can be doing the nurse extern program. So it's like internship for student nurse. So you can do that as well. It just depends on your life circumstances. I do have kids. I went to school as a single mother. I had my twins. My twins were 3 years old. I just got separated. I was going through a divorce. It was hard. So yes, I went to school as a mommy of two. Quizlet practice for your exam. Nothing comes. You know what? It's not that you're gonna get the same questions. Don't put in your mind that you're gonna get you the same questions. It's not the same questions that you're gonna get, but study on your concept. Okay? There are things in nursing school, prioritization questions, right? You have your ABCs. You have your airway, you have your airway, you have your breathing, your circulation. So let's say you're between your patient that's bleeding and your patient that can't breathe. Who do you save first? You have to know those concepts. That's that. You know what I mean? You have to know those concepts. Between your patient that's bleeding and your patient that's screaming in pain, crying, screaming, the whole hospital can hear them, and one that's bleeding, you're gonna go to the one that's bleeding in silence. The one that's in pain is not gonna die now. They can wait. Pain never kills anybody. You'll cry, but you're not gonna die. But you're gonna save the one that's bleeding. You know what I mean? So between your patient that's having a chest pain and your patient that's crying in pain, you're going to save the one that's having chest pain, because that can be a myocardial infarction. You know what I mean? So don't study for the questions to come up. Study to understand your prioritization. And you have to look at your Maslow hierarchy of needs, right? You have to finish with your physiological needs first before going to self-esteem, self-actualization, belongings, and love, and all of that. Your patient has to have food. They have to have a house. Case manager has to take care of these patients that don't have a place to go to. You know what I mean? So your patient that does not have food, you can't let them and go care about your patient that feels lonely. The one that's lonely would be fine. So it's all about prioritization. Who do you save first? You know what I mean? Who do you save first? So you have to understand those concepts and don't look for the same questions to come for. Look for the understanding of those questions. Okay? Your ABCs must be your best friends, your as your ADPI, right? You have to do your assessment, you have to do your diagnosis, all of that. So your patient comes, they tell you something, you have to assess first. So it's your assessment first, then your diagnosis. You can't diagnose your patient without assessing what's happening. Your vital signs, between your vital signs and let's say they tell you your patient has low H&H. So you have to see what's priority. So if you go with that, you will be fine. Don't look at the same questions, okay? What are the recommended website to take online prerequisite nursing classes? I'm not sure. It's gonna depend on the school. If you go to a school, let's say a community college in your area, they might give online classes. So just go and ask them about the program and what they need you to take, because each school is different. For LPNs, sometimes they ask more than 3 prerequisites. Some don't even ask prerequisites. Some will just ask anatomy and the T's. It just depends on the school, okay? Your professor tells you after answers all the questions. Uh-huh. So I had a person comment under one of the latest videos. She said that the professor gave them 8 select all that apply questions. All I know from select all that apply, the most was 5. The professor gave 8 or 13 select all that apply. So them professors can be crazy though. So yes, guys, that's that. I'm so happy you guys are here. Oh, you changed all your answers. That was correct. And you found. Don't change. That's one thing too. Don't change your answers like that, guys. Don't second guess. When you go through elimination, right? You answer, you go through elimination. Sometimes, if you know that that's your habit to go back and just mess up your answers, don't go back. Make sure you take your time to read the question. Go by elimination. I used to write down when I start an exam, I'll write down all my lab values on a piece of paper, because I know my brain is fresh. All my potassium, my calcium, my magnesium, my H&H, all of it. I'll write it down, right? If we're doing ABGs, acid balance and all of that, I'll write everything down and then take the question. If it talks about lab values, I'll look at it and answer. And I know I'm one of those, I'll go back and mess it up for myself. So I won't go back. I'll just finish. Just go ahead, turn in my paper and go home and pray. Pray before your exams, guys. Very important. Always pray before your exams. You need God guidance and ask him to, guide your pen and guide you. Very important. All right, guys. Oh, Shen, I'm happy that you're buying, guys, and you liking all the products. I personally go through all of them and make sure, like, everything that I suggest is based on what people are requesting. Can you recommend me this and that? And I will take my time to research the products that are out here and see what's actually appropriate and what actually adds values to you as a student, as a CNA, as an LPN, as a nursing student. And now I have stuff for my EKG students. So that's the EKG cards. So yes, I look for the best stuff. Yes, always pray. Always pray before your exams, guys. You never know. Those devilish cousins and family members, you never know. Sorry. But yeah. Good luck. Good luck. You got this, okay? You got this. Daughter of God, please message me and I will just send you some, some websites that help me out. Message me. You got this. Never give up. Nursing is hard. Sometimes in nursing school you ask yourself if you're you're meant to be smart. Nursing will push you to your limit. I promise. But you know what? Half of everything that you guys learning in nursing school, you're not gonna use it. You're not gonna do a care plan out of your brain. No, everything is in the computer. All the potassium, all the electrolytes are already made in the computer. When it's abnormal, it's red. When it's normal, it's gray. So when you open your chart to get report, all the red stuff, that means it's abnormal. You don't even have to think anymore. Sometimes we forget. Like, what? What's the normal? Just because the computer does it for you. It makes life so easy. But then again, when I study with people, I have to remember all this stuff. Good luck, people. Good luck, my people. You got this. Nursing school is not easy. But if I was able to make it, I worked 2 jobs, guys. I worked 2 jobs as a CNA. I did Fridays, Saturdays, and Sundays. Day shift and night shift. Because I had to pay bills for my babies and I. And I was studying at the same time. So you guys got this. You got this. Just force your brain. And especially for us that have English as a second language, it's not easy. My professors told me, they were like, hey, medicine is its own language already. You know what I mean? So even the English speakers struggle with medicine, with nursing. And then if you speak French, you speak Bambara, you speak Wolof, you speak Lingala, and now you have to learn English and learn medicine. It's not easy, but it's doable. Keep forcing your brain. Your brain is like a muscle. It's a muscle. The more you work out, the more you get some muscles, the more you get better at it. Just work out every day. Do all type of practice questions and read your rationale. Daughter of God, every questions that you're done, especially the ones that you've done wrong when you're practicing, read the rationale. Rationale is the explanation that says why the right answer is right, why the wrong answer is wrong. Okay, read those so you can go by elimination every time. I love elimination process when I take my exams. Okay, you got this. You got this. You got this. French is your first language. Same here, mama. Same here. But look at us. Same here. All my friends here, most of our friends here, Miss Solange, lots of us here speak French. So ne vous inquiétez pas, l'accent là, c'est, ma chérie, il y a les Chinois, les Latinos, les Indiens, tout le monde a des accents bizarres. The most important, c'est de comprendre le concept et de comprendre. Explain it to yourself. Explain it to your kids. I used to get my twins, they were 3. I'm like, sit down, let me explain this to you. Just try to explain it to yourself, to your friends, to your group study friends and everything. Explain that to each other. So the more you explain the concept, the more you get it. And try to use Picmonics. Picmonics are very helpful. Je t'enverrai de bons sites. Tu verras, ça va t'aider. Je suis West Africa. J'ai grandi West Africa. J'ai grandi en Côte d'Ivoire. Et j'ai fait 1 an et demi au Sénégal. Mais je suis du Congo. J'étais née au Congo, en fait. Je suis congolaise d'origine, mais ivoirienne, congolaise de sang, mais ivoirienne de everything. Pretty shy. Hi, sister. All my Cameroonians and my Senegalese, my Malians, my Ivorian, my Kenyans. I have everything. My Asian. Oh my God, my Asians. Guadeloupean. We have Nigeria, we have Ghana sisters, we have everybody. Ah, Lola is from Ghana, Nigeria, exactly. Oh, my Togolese people, you are exactly. Hey, Manangaye, tu sais, Banamboka, il y en a plein de vous ici. J'adore cela, j'adore cela. Léocardis, Mwanamboka, vraiment. Malukai, Mamu. And I see some Baluba ici aussi, Malukai. Nangade for everybody. Vraiment, we got this, guys. On est intelligent. D'où on vient, on est smart. On est très intelligent, mais parfois, on se met le blocage de la langue et tout ça. Ne vous mettez pas le blocage de la langue. Je vous dis, je suis partie à l'école avec les Pakistanaises, là. Elles peuvent rien dire. Même les Éthiopiens, là, il n'y a rien qui sort dans l'anglais, là. Mais toutes ces personnes ont gradué. Tu peux reprendre une classe, c'est pas grave. Il y a plein de gens qui ont repris des classes. J'ai une nurse ici, là. Elle est ICU nurse maintenant. Elle a été renvoyée 4 fois. Elle a changé d'école 4 fois. Elle a échoué les NCLEX 3 fois. C'est la 3e fois qu'elle a pu passer. Donc, ça lui a pris des années pour pouvoir passer. Mais aujourd'hui, elle est ICU nurse, ICU travel nurse. I promise, guys, nursing is no joke. But, la persévérance, ça t'amène quelque part. Parce que quand tu finis, life changes. I promise. Parce que si tu as l'énergie, les hommes même, c'est grave. Les hommes, c'est la femme qui reste à la maison qui s'occupe des enfants. Les hommes vont avoir 2 jobs. Tu as un job ici, le paycheck rentre $3,000 par semaine, $2,000 par semaine. Tu as un autre paycheck là-bas, $2,000 ou bien 1,500. Tu te retrouves en 2 semaines, tu te retrouves avec un $5,000. En un mois, tu as un $10,000, je vous promets. Nursing, c'est de l'énergie. Tu vas travailler jusqu'à ce que tu seras fatigué. Et tu peux faire 2 jobs, tu peux faire 3 jobs, tu peux faire anytime job. J'ai des nurses, they are in the hospital, they work in one hospital, they're full-time job 3 days. They are PRN somewhere, they do 2 jobs. And then they are case managers somewhere. Case managers, maintenant même tu fais les video calls à tes patients. You don't even have to go see them. Et tu chart, and they pay you for that. Tu vois un peu? So, nursing, c'est un business pas possible. C'est pour ça que they make it so difficult, mais c'est possible. I promise. You guys, you got this. Ah, je conseille LPN. Entre MA et LPN, ça prend le même temps. Je conseille LPN parce que quand tu commences en tant que LPN, tu as plus d'opportunités. Medical Assistant, tu ne vas pas avoir beaucoup d'occasions. Par exemple, si tu veux faire travel MA, mais si tu fais Travel LPN, si tu conduis seulement 1 heure de ta maison ou 2 heures de ta maison, c'est considéré travel. Tu te fais le double de l'argent que tu te fais. Vous savez ça? Et dans le même hôpital où tu travailles, il y a des gens qui se font $40 en tant que nurse. Il y en a qui sont float pool qui se font $100. Les float pool qui se font $100 par l'heure, tu sais pourquoi? Parce que par exemple, ils vont dans les différents, le même hôpital à 4 locations. Donc, on t'envoie dans différentes locations. Ou bien on t'envoie dans différents floors. Aujourd'hui, on t'envoie ici, demain, on t'envoie là-bas. Mais après 1 an, 2 ans, tu sais ce que tu sais ton travail. Donc, tu peux travailler partout. Donc, tu as le même nursing job là. Quelqu'un se fait $100 à l'heure, toi, tu fais $40 à l'heure. C'est le business. C'est vraiment super. Tu vas, tu saves the life et puis tu te fais l'argent aussi. Ça va bien, Claudie? Ça va. Okay. Guys, it's time to go. Thank you so much. Thank you for being here. LVN et LPN, c'est la même chose. Licensed Vocational Nurse and Licensed Practical Nurse, c'est la même chose. C'est juste les appellations qui sont différentes. Un second job que tu es nurse ailleurs. Of course, everybody knows that you have another job. Like all our PRN nurses, we know that they have the main job somewhere. Tu peux dire, oh, I can't pick up this day because I'm at my main job. C'est l'Amérique, on s'en fout. Once you become a nurse, be sure of yourself. Ne laisse pas les gens te parler n'importe comment, te piétiner ou quoi que ce soit. Les gens là vont essayer de te bully. Il faut juste connaître ton travail. Quand tu connais ton travail, c'est fini. No more. Alright guys, stay blessed et puis on se dit à bientôt. Salut Abba, on est en train de rentrer, partir là, ça fait 3 heures qu'on est là. Tu as beaucoup de questions, s'il te plaît Abba, il faut m'envoyer le message, ok? On va partir. I'm not a CRNA, I am a med-surg nurse, I'm a BSN registered nurse. CRNA takes 3 years to get to the doctorate program. I wanted to do that, but I changed my mind. I'm gonna go for nurse aesthetic. You know, those that do the Botox, the lip fillers, the hair removal, anything that has to do with beauty. That's nursing too. I have to become nurse practitioner first. That's what I want to do. Euh, Tu n'as pas besoin d'un niveau pour CNA. Tu n'as même pas besoin de BSN. Mais je sais que ton English doit être au moins niveau 4 pour commencer. Ok? Fanta, thank you, my love. Thank you. Nurse informatics, beautiful, guys. Nurse informatics, they don't do shit. Okay? They don't do anything. They're just sitting there when the hospital roll out a new a new system. They come and they train you. And if you have any issues logging in or some things like that, you call them. They don't do anything, and then they train the new nurses because the EMR, right? You have Epic and you have Cerner. So some hospitals will use Epic, some hospitals will use Cerner. So every new grad that comes or every new hire, every new person that they hire, they'll come to train, they'll train you. Oh, this is how you go put the patient in, this is how you document. There's nothing for nurse informatics, but you have to have at least a year or two as a nurse experience and then go into that. From nursing to dental hygiene? Why though? You're welcome. Thank you, Blondell. Thank you. Stay blessed too. Yes, child of God, message me. Message me. I will send you my tricks to study. You got this, guys. Thank you. That's why I'm here. Nemba, love, 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 guys. Please message me if you have more questions, okay? Thank you. Bye. And don't forget to check the YouTube feeds. Thank you. Bye-bye. Your full-time experience now. New achievement now. Thank you so much, guys. Nobody's here available, so I'm gonna end. Thank you, thank you, thank you.